Welcome to the Dr. Greg Show, November 20th, 2025. What a day, what a day. The ripples from the CDC nonsense and the website has gone rippled through the social media ecosphere. We have to watch the second half of that nonsense, that wild interview that was just so crazy. That we're watching, and then that basically that professor even admitting that even her own data didn't make any sense to herself, so she had to make some stuff up. She literally said that in that interview. And I think that we are the only people on the internet to actually deep dive and find that professor, find that publication, find that interview. So I'm pretty sure that is a Dr. Greg exclusive. I'm pretty sure, guys. I'm like 90%. I'm like 99% sure. I got them 2 p-values out, guys. We are 2 p-values out. Nobody else is deep diving like that. Who else does that? Who else would do that? Nobody. Just us, man. Just us. All right, guys. Well, thank you so much for being here. I appreciate you. We're going to get into it pretty quickly here. All this stuff, talking about this video, and yeah. The first things first, I wanted to go over. This was the reason why that website has that little asterisk after it, where this is the physician. If you remember, we were watching the RFK Senate hearing, and there was a sole Republican that was like, you say you want to make America healthy again, but you want to spread disease. How does spreading disease make people more healthy? That was this guy. That was Bill Cassidy, who is a physician, and he must be pulling his hair out because he has seen his party slide toward not just anti-science, anti-public health, and he is the lone dissenter apparently in the Republican Party, enough sway to actually have the CDC push the asterisk so that they actually had to keep one title that said vaccines do not cause autism, asterisk. And this is the statement that he put out after the CDC changed to just straight disinformation mode last night. Quote, I'm a doctor who has seen people die from vaccine-preventable diseases. What parents need to hear right now is vaccines for measles, polio, hepatitis B, and other childhood diseases are safe and effective and will not cause autism. Any statement to the contrary is wrong, irresponsible, and actively makes Americans sicker. We need to understand the real cause of autism. Studies show that there's a genetic predisposition when a mom who's pregnant is exposed to environmental toxins, which can increase a child's risk of autism. It's deeply troubling that, according to HHS officials, they appeared to have canceled hundreds of millions of dollars in research on autism genetics. Wow. It's almost like they wanted to sow discord and sow misinformation, and they wanted to stop the science from getting out there, just like how they tried to stop that publication in Denmark that showed that. Wow. Redirecting attention to factors we definitely know do not cause autism denies families the answers that they deserve. We had 2 children die and many more hospitalized nationally from measles this year. Louisiana is experiencing its worst whooping cough outbreak in 35 years. Families are getting sick and people are dying from vaccine-preventable deaths, and that tragedy needs to stop. So, here we go. That's the deets, right? That is the lone Republican dissenter. The one guy that actually has some sway, hopefully, maybe somehow. But alas. So, if you remember, this is an atmospheric scientist who wrote a single paper on the atmospheric rates of mercury and tried to claim that it showed that autism was linked. when she didn't have that data and she couldn't provide that, she changed and started saying, well, maybe they're getting mercury in other cases. Maybe it's other things. And she linked about 300 graphs thinking about that would maybe be where it is. And of course, she had no causation, just correlation the entire time. And guess where we're at now? We're at the CDC sourcing this nonsense, right? They are sourcing this now and actually pushing this nonsense, and it is embarrassing. So it is, we're going to go through the second half of it, Meg. Good evening, Helen. How are you? All right, guys. So we're going to go through it right now.
That most of the mercury has been taken out of vaccines. It's still in these multi-dose flu shots. Yeah. So I would be wary of that, especially if you get it at a supermarket.
So
or something.
again, she's even her own data doesn't make any sense.
This goes back to I was talking about the Landrigan et al. 2012 paper that really prompted my entry into the world of autism.
Remember that she was prompted into this research because she was at the supermarket and she saw, quote, a well-dressed autistic boy having a meltdown. And that was enough for her to be afraid of her child becoming autistic herself. Because apparently non-autistic kids don't do temper tantrums. I don't know. Yeah, nonverbal autistic kid. Who famously, children, when they're having a temper tantrum and melting down, are very verbal. They're very articulate in their words. But this is actually what it is. This atmospheric scientist going up against the entire medical industry, and here we are.
Publishing to list methyl mercury as one of the top 10 causes of autism and development and I think learning disabilities.
Delays, yeah.
As though somehow ethyl mercury is totally fine, was just so selective and so arbitrary that that really was not a very inspired move on their part.
Yeah,
I think, too.
Yeah, I'd have to agree with you. Have you only done academic work on autism, or have you also been involved in advocacy? And if you have, how did you start?
Right.
Yeah, I'm an atmospheric scientist looking at nitrogen
for
levels.
A number of years, probably from 2010 through 2018, I was only doing academic research, and I lived in a state where we had a personal vaccine exemption. So I was one of those moms who didn't do all the vaccines. I did some of them.
Oh my gosh, she's a bad parent.
And
she's a bad parent.
Nobody hassled me. Well, except for the school secretary, but that's a long story, and I won't tell that. But
if you're coming in late, this is the person who is informing the entire CDC right now on the fact that environmental factors are causing autism, not genetics, which is completely wrong, misinformation, nonsense. But this is who they're listening to. This is who the source is. And she has a paper out that is going over it, and we are talking about it. So that's the this is the paper with her, Cynthia Nevison.
Then in 2018, I was asked to testify as an expert witness before the Colorado State Assembly, and there was a bill that would have declared autism a public health emergency. So it was a bill that was sort of written by parents with somewhat severely autistic children, and I think they were called the Colorado Health Freedom Alliance.
Always freedom.
I think they had a different name at that time. Anyway, I was told that I would have 15 minutes to testify.
Okay.
So I was just basically there to document that autism is actually increasing. That was the issue in the bill. When we got to the hearing,
famously she said it's actually really increasing for real. That's what she was saying. Like her whole paper was that autism is actually increasing. But of course, if you redefine what autism is and you increase the tests on it and you capture more people, then yeah, you are going to increase it. You know, it's not going to increase at this rate for the rest of time, but it's increasing right now because of that.
Democratic chairwoman of the hearing said that, sorry, Cynthia, you only have 3 minutes to give your presentation. And I'm somebody who, I prepare things carefully, and I look at my time allotment. So I had a 15-minute presentation, and I had 3 minutes to deliver it. And then the sponsors of the bill, the parent sponsors, I mean, they had one assemblywoman who was their actual sponsor, but it was really the parents pushing the bill. They were livid. And there was some sort of behind-the-scenes, last-minute fighting that went on. And finally, the chairwoman came to me and said, okay, we'll give you 10 minutes to testify. Mm-hmm. So I had a 15-minute presentation that I cut on the fly to 10 minutes. And I was definitely flustered by that.
Yeah, Amelia, that's right.
I think I probably came across as more strident.
It's like an hour left, so we can't really pause it that much. But you're right.
And I really felt like the bad guy because there were.
Well, she has no idea what she's talking about, and she's going against the entire medical industry.
Children who'd come to testify against the bill.
Yeah, you're a bad parent. You're a bad person.
Beautiful children.
Yeah,
and
you're trying to harm them.
And the bad guy were challenging their right to exist. In their view, and that's
true.
And I really did feel bad about that, and that's not what I.
She's like, there's repercussions to my actions, guys. I don't know what's going on.
So anyway, the bill was voted down 12-1 in committee, and then fast forward to 2019. So that was 2018.
All right.
I wouldn't really say I was an advocate at that point, but I was sort of entering the political arena. And then in 2019, the Democrats, and I'm sorry to pick on the Democrats, but they are the ones pushing these vaccine mandates. They sponsored a bill.
Yeah, they're the only ones that are like doing things about like healthcare and trying to like make sure that people aren't sick all the time. That can pay for it. They're doing all these weird things that are like trying to help people. Like, what's that? What's that all about, guys? It's like unbelievable, dude. Unbelievable.
It was based on the California, I think it's SB 277, a complete crackdown on vaccine exemptions for school children.
Good. They shouldn't be there.
They were promoting that bill, and I went around. I created a little slideshow. I went around to
50 hearts.
Legislators and tried to talk to them. Often they would.
You have no idea what you're talking about.
They would send me to talk to their aide, who was usually like a 20-something, intern.
Yeah, you don't deserve to get anyone to talk to anyone. You're not an expert.
They would roll their eyes when when they saw me coming. So they didn't want to hear, and that bill was killed partly because it was introduced somewhat late in the session, and also our Colorado Governor Jared Polis said he would veto it.
Good.
And Polis, I don't know if you've heard the news, but he came out yesterday as praising Robert F. Kennedy Jr.'s nomination to be Health and Human Services Secretary. So here's a Democratic governor.
It's awful.
Who I think sees which way the wind is blowing, and
to be
fair to him, he did help kill the worst version
Jeffrey
of that bill.
Paulus, RFK nomination.
Unfortunately,
Colorado.
They brought the bill back in 2020.
Thanks, guys. Thank you.
It was
Thank you,
a
Rapture.
watered down version of it, where now, rather than having no exemption rights, you have to get third-party authorization, meaning you have to get a doctor to sign.
Here, he's not praising. I was raised in a way where I try to look at things as half full. So he's not praising the nomination. He's saying that he's just saying that he's trying to look at the best case scenario. I'm excited by the news that he will elect Robert F. Kennedy. He helped us defeat vaccine mandates in Colorado in 2019, and I will help America be healthy again by shaking up the HHS and FDA, the governor wrote in a platform on X last week, referring to the FDA. Okay, that's a little stronger than I would like. That doesn't make any sense. While opposed to RFK's position on a host of issues, including vaccines and banning fluoridation, he would appreciate seeing action on pesticides and efforts to lower prescription drug costs. And if Trump is going to nominate someone like him, then let them also take on all the stuff that he doesn't like. So he's trying to basically see the glasses half full. So yeah, I mean, she is right though. He is praising her. Kind of weird though.
Or you have to watch their re-education video that is, quite biased and omits a number of, it fails to really, I think, inform about both sides of the issue, about the risks and the benefits of vaccines. Anyway, you have to sit through that video, enter your child into a registry,
Good.
or get a doctor to sign off,
Yeah.
which is not easy. But
Yeah.
at least we still do have some exemptions.
It's hard to get the doctor to sign off on it. Yeah. Yes, for good reason, lady. What are you talking about?
In California. So anyway, that was kind of my switch from being purely an academic researcher to also being involved in advocacy.
I love that.
I love that.
You talk about the risks and the benefits. I mean, a lot of people are aware of the risks, but not a lot are aware of the benefits. Are there benefits to these vaccines, particularly child vaccines?
Are there benefits to childhood vaccines? That is a great question. What would be the benefits of vaccines? So this is it, guys. This is their chance. They don't want no vaccines. They want safe vaccines, gold standard science. So here we go. This is her chance. She's going to clear her name. She's a medical expert now. She's a atmospheric scientist that somehow has stumbled into becoming a medical expert. She is going to talk and educate us about the benefits of vaccines. What are the good benefits of vaccines? Take it away. Cynthia Nevison. Go for it.
Well, I think that some of them, especially the live viral vaccines, have definitely decreased the morbidity of these diseases, where morbidity is its own.
That's the one with thimerosal in it, by the way. That's the one with the mercury in it that she was just spending 30 minutes and a publication dishing on, by the way. Unbelievable.
It's like a horrible word, but it just means the incidence of disease.
Mm-hmm.
And
That's it?
That's separate from mortality, which is death caused by the disease.
That's it?
So I think that,
That's it?
the measles vaccine
Please?
has been effective at reducing the morbidity, the incidence of measles.
Okay.
But the mortality rate was already, down. I
She's
think,
got
at least
nothing?
95% from its historic level by the time that vaccine was introduced around 1963, I think it was.
Oh my gosh,
So,
dude.
so there's that benefit, but on the other hand, there's a downside, which is
Oh my
that
God, she
mothers-
couldn't even get through a single sentence. She couldn't even get through the single sentence and had to go and talk about wow. This is who is informing the CDC right now, ladies and gentlemen. This is the author of this publication that is informing the CDC. Unbelievable, dude. She couldn't give a single benefit of this. Yes, Alejandro. Yes, everyone should get the COVID and the flu vaccine every year. Yes, you should get the boosters every year. Yes.
Mothers are no longer passing maternal antibodies for measles to their babies, and that's what used to protect the newborns
Why is
from
that?
measles and help them along until their immune systems were mature enough to fight it off. And then you have older people who because they'd had measles as a child, they had lifelong immunity. But when you get the vaccine, people my age, and I was one of the early recipients, we probably have no immunity left to measles, and I think I would have been better off just being allowed to have it as a child.
What? What?
so,
Oh my God.
I think they're
So this is in her benefit to vaccines. She's just lying. She has no idea what she's talking about. She has no idea what she's talking about. There is a second booster now because of this, the kids, and it's like, it's so dangerous what she's talking about here. She has no idea. Even in her own, what are the good benefits of vaccine answers? She's literally giving disinformation right now about all this nonsense. It's crazy.
there are some benefits, but there are also downsides. And
Like what?
the thing about this
What are the
education
downsides?
video that the Colorado
What are the downsides to getting measles? It's so easy.
Public Health Department puts out is I think it exaggerates the benefits and it ignores the downside. You know, it doesn't even discuss the downside. And I'm talking about not only the side effects that have nothing to do with the disease, like with what we've seen with the COVID vaccine, the myocarditis,
Oh my God.
strokes, the blood clots,
Idiot.
etc.
Idiot.
But they also have downsides for the
What an
targeted
absolute
disease itself.
moron.
And that's what I was discussing with measles. Is you're sort of weakening the passive maternal
You're
immunity
not.
that used to
You're
protect
not.
newborns. And I think that's why we're seeing this big push to vaccinate pregnant women. There's
Holy
the hope
shit.
that we can they will generate maternal antibodies.
They
And
do.
then, transmit those through
They
the
do.
placenta to their baby to get the baby through those first few months of life. But at the same time, you're activating the maternal immune system during pregnancy, which is not great either.
What are you
So
talking
it's-
about?
I mean, I think in principle, vaccines are a great idea, but in practice, there are a lot of downsides that are not adequately discussed, and parents
Oh
are
my
not,
gosh.
are not adequately informed on what those are.
So she has no idea what she's talking about. She has no clue actually what the science is or the stats or anything. She was given the biggest softball question that you could possibly give, and she gives just an absolute rambling nonsense reply that doesn't talk about any of the downsides of the diseases that vaccines prevent. And she just goes on a rambling tirade talking about how the vaccines are actually more dangerous and nobody talks about the vaccine dangers. Yeah, because that's what's going on right now. We're talking about too many of the vaccine benefits, you know what I mean? What an idiot. Why don't you want to know why she believes so? No, Ruben, I know why she believes this nonsense. She doesn't understand what she's talking about, and she's been indoctrinated because she's talked about the books that she read that are completely wrong and from the 1990s, and she's using and just spewing this garbage out, and this interviewer has no idea what she's talking about, and she can't even respond.
Correct. Do you feel like we have enough research on vaccines for it to be?
Do we have enough research?
Effective, like, or not as doesn't have like that negative impact on kids? Is there enough research on it, or we need to like do more extensive research on vaccines?
I think we need a lot more research, and even
Oh my
the
gosh.
authorities themselves. Somebody named Stanley Plotkin, who's
What
the
an idiot.
godfather of vaccines, he wrote the textbook of the same name, has admitted that.
Okay, let's look it up, guys. It's Stanley Plotkin. What do you think? When was this book written? What do you think? What do you think? Vaccine book? What do you think, guys? When do you think it was written? He was born in 1932, aged 93. His book, Vaccines, his book, his last book, his 8th edition book. For the first publication date, 1988. Famously, vaccine science hasn't improved at all since 1988, and we are using the same same vaccine technology, the same molecular biology, all the same tools, everything since 1988. Nothing has improved. No studies have been done. What an absolute moron. I would be so embarrassed. Hi, Marissa. I would be so embarrassed going out here acting as an expert on something that she has no idea about. Like, it's unfathomable. Like, why don't these people have any shame? That's what I can't grasp. How can this person have zero shame? That is what they should study genetically. Like, how can this person just go out there and just talk so much nonsense? Oh. I would honestly love to see her debate a flat earther. And I would love to see how she deals with these scientific consensus questions. That the same scientific consensus questions that they would have for vaccines, for flat earth, how would she deal with that? I got 5 calls today on all my representatives about the president making death threats to Dems. Nice, Marissa. Very nice. Well, count it. Anyone who does anything and calls it for any reason, I think that's a good thing. I thought that was just so wild that he is sitting there doing that. 687. Let's give it up for Marissa, guys. In 3, 2, 1. Yes. How do you know that she's not a flat earther? Oh my gosh, Gia, that's a good question. That's a really good point, honestly. We don't. We actually don't.
One book that I would really recommend for new parents or prospective parents.
Hi, Great Rochelle.
It's
Thank you,
called
man.
Turtles All the Way Down. That really explains in very readable and extensive detail the problem with the safety studies. There literally has not been
A randomized control done on any of these. She's gonna say that. Watch, guys. Watch. Okay, she's gonna say there's not any been randomized double placebo done studies on anything with vaccines. Okay, ready? In 3, 2.
except for the COVID vaccine, a single double-blind placebo
Wait. She said that they did do it on the COVID vaccine. What?
study of any of the vaccines on the childhood schedule, let
What?
alone on the synergistic effects. of
689.
giving all those shots at
3,
once.
2, 1.
And when the most
They've done so many of those. They've done all of those. The entire vaccine schedule at once. Like, how could she say that? There's been no studies. What is up with this? What is up with this? How can people just say this? I just can't believe it. I can't believe it. But she agrees that they've actually been done on COVID. I am so confused. What's up, Ruben? Thank you, brother. But they have been done on COVID? That exactly, Bill. What was that?
egregious example is probably the Hep B birth dose.
What?
Where the study for that was, first of all, there was no placebo, there was no control group whatsoever.
How would you have a control group?
2, there were 150 children.
Hey, what's up? Hey, so we're gonna infect you with Hep B. Okay, so chill. All right, this is for. Okay, all right, okay, chill. Thank you, Bill. Okay. Just hear me out. We're gonna infect you with Hep B. Okay, chill. All right. Whoa. This is for science. Guys. I wonder why we don't do a bunch of experimentation on pregnant women and newborns that just got born. I don't know. Anyone? Just any ideas thrown out there? Why aren't we doing? It's so unbelievable, dude. And I love that these guys think that they are like this onion peeler of like truth and fact. And it's like, oh my God, nobody's even thought of this before, man. We are like, this is like Atlantis of academia. That's wild. Like, oh my God, dude.
Involved, something like that, from age 0 to 10. So who knows how many of them were 0 and how many were 10? Maybe most of them were 10.
No, Ruben, she doesn't think that there have been any studies on there. And I'm saying that the reason why we haven't done any of those tests, those are the tests that she's calling for. She's calling on scientists to experiment with pregnant women that are giving birth and their infants, okay, through a double-blind placebo study. And she wants them to be exposed to Hep B and purposely exposed to Hep B. I mean, if you don't understand why that's unethical, I mean, I don't know. There's so much wrong with that, dude.
And then there was 1 or 2 babies, and then finally they followed the children for 5 days after the
5 days
vaccine. 5 days. Just not
exactly,
nearly enough time.
Ruben. Exactly, brother. Exactly. That's why. This is insane. But see, Ruben, what they're doing is that they are setting up an impossible standard. That's the point is. They're setting up an impossible standard that science could never come together and actually do. So they're saying, hey, if you don't do our little standard here, then you're not gold standard science, and we don't respect your science. That's bad. That's bad, guys. That's really bad. Oh, hey, Rapture on YouTube. What's up? Oh, yeah. This is my office. Yeah, I've got my computer in here and everything. So you don't test it on pregnant are you going to say give it to them as a vaccine? Yeah, I mean, so they test the vaccine on other things other than the pregnant women in order to know that it's safe. And then they monitor the fact that we've given it to women that are, Hep B positive and Hep B negative, and then they look at that, so longitudinal study over time, and they see that the Hep B vaccine protects the baby from chronic infection, and they see that it helps the vertical transmission rate, which is from mom to baby. So it is absolutely studied, and the safety is absolutely studied. It's crazy.
To look for long-term, impacts on the immune system.
Yeah, Bear. I'm sorry, we've got to go
this
through it.
This vaccine is universally recommended for newborns in America.
Well, so how do they know if it's ever safe for pregnant women without tests, though? They do. They give it to them, and then they check and make sure that it is. They see how it is, with regular people, right? And then with pregnant women, and then they check and look at for different risk factors that are associated with that. But they know that giving it to a baby is safer than the Hep B infection, right? The Hep B infection is going to be 90% of Hep B infections at an infant stage are 90% are chronic, long-term, lifelong infections, dude. It's a ton of really bad medical outcomes because of it. It's really bad. So it's way safer, right, to expose the baby to the vaccine than it is to chance it with that Hep B chronic infections. That's why. What percentage of Hep B babies get Hep B? If they have their mom has Hep B, then it's a large percentage, right?
Hospitals, and sometimes they're...
We have basically stopped babies from getting Hep B by doing the Hep B vaccine. So that's why you don't hear about it anymore, because it's so effective. So that's the reason why. Well, we don't have it anymore, Stina. That's like how many people get polio, and you're like, well, nobody really gets polio anymore, but that's because of the vaccine. So do you know what I mean? It's like that's the whole point, right? Yes, exactly. They are allergic to vaccine.
Or the vaccine without their parents' knowledge or consent at a lot of hospitals.
This is true.
So
they don't do 5-day follow-ups. They do much longer than that.
We need more research. We need double-blind, placebo.
They do.
Studies that follow.
Jojo, but guess what? Hep B and the diseases that are protected by the vaccines are a lot less side effects. The real side effect of the vaccine is getting the disease, not the side effect of the vaccine. So you're not looking at it right.
Followed for days to months. They're not,
Yeah, but they are babies, exactly, and that's why exposing them to Hep B is unethical, and that's why you're a bad parent if you decide not to vaccinate your child.
We're looking at sort of long-term...
Okay, truth teller, then get in the box and argue with me, then debate me.
Immune system effects, and you really need more time, a longer study period to really, sort out what those effects are.
Yeah. Have you heard
they
of
won't,
the no
though.
vaccine law?
They never do.
I mean, I don't know if other states have it, but right now, parents are kind of doomed if they don't vaccinate their kids. There's no pediatrician that accepts them in their office for treatment.
Well, good.
Because we're a liability.
Right.
Yeah. Well, good.
Yeah, no.
Hep B was a thing in Alaska like 20 years back, not really a thing outside of that. Yes, Sarah, because of the vaccines. Yes.
Oh, and I think the expert on that
Yeah,
topic
you're
is
just
Dr.
wrong.
Paul Thomas.
Yeah, or you can get in the
You
box
may have
and you
heard of him.
you are
physician,
wrong, Sarah.
He was a pediatrician in Portland, Oregon.
He got his license stripped, right?
Good.
He got his license stripped. And he had a study. He's done studies. He started to.
They should get more of these people stripped their license, not
and
less.
He had a lot of parents who either only partially vaccinated or didn't vaccinate at all. And he's published a couple of papers have been published on his data. This is before they stripped him of his license.
Yeah, he's probably unethically doing the research.
Not just autism, but a lot of conditions, anemia, ear infections, just getting sick in general among the unvaccinated group.
Yeah, Yeah.
But anyway, he has talked
She-
a lot about the financial.
She is the person that's informing the CDC incorrectly now and trying to strip vaccines from the United States and trying to hurt people and spread disease. She obviously doesn't believe in viruses. She doesn't understand the disease.
incentives that
Yes.
pediatricians have, and he said that he realized at one point that his office was losing $1 million a year. because
Oh
he was
my
foregoing
God.
all these various
This is another
bonuses
thing.
that the insurance companies at the hospital.
That's a
Not
great,
quite sure what the how
Ruben,
the
that's a great question, brother. That is a great question. They link to the study, and it's literally a single author, a single person, unable to corroborate anything that they say with science. No, the truth isn't coming out. It's just a bunch of nonsense and authoritarians that are taking out the exact institute of science that has protected us over the last 100 years. And people like you, truth teller, have done nothing to help public health. You've only done things to dismantle it. That's the problem. Conspiracies and nonsense and alternative medicines have not helped anyone.
structure works. But there are a lot of bonuses. Incentives.
Not really, Marissa. We looked into her paper, and it's really just kind of, it's not really. It's kind of laughed at, to be honest with you.
If you will, for the pediatrician to give these vaccines, and that's probably why they bully parents, or they push these vaccines so aggressively. I had a situation like that where a pediatrician, I went to sort of a mainstream doctor because she's
a PhD of atmospheric science. So she does environmental nitric oxide in the environment studies. That's like what she actually does as a professor in Colorado University. And now, for some reason, she thinks that she is a medical expert that can take down the entire medical science. Matt Lawson, no, alternative medicines are either medicines or they're not. So that's the thing, is if they're studied and they're shown to be effective through studies, then they become medicine. Alternative medicine is stuff that has not been studied and not been proven. So there is no space for alternative medicines. Yeah, she
my
is.
insurance. I only lasted like maybe two visits with him before I couldn't take it anymore. But he was trying to bully me into giving my son the HPV vaccine, and I asked him, well, how much aluminum is in that shot? And he hit the roof. He didn't like the
Dude,
question.
do you know what's in a virus? Do you understand what's in the measles? Do you understand what a virus is?
He got really angry.
Triggered him, huh?
Wait, what'd
So
she
I-
say?
I-
What'd she say to this
He
guy?
got really. He hit the roof. Well, how much aluminum is in that shot?
Oh my
And he hit
God,
the
what an
roof.
idiot.
He didn't.
What an idiot. There is more aluminum in milk, in breast milk, than there is vaccines. So, yes, we do know what's going on in vaccines. Yes, we do. Yes, we do. Do you understand what's going on in a disease, what a virus is? So,
Like the question. He got really angry.
Triggered him, huh?
yeah, it's crazy, Sarah. We don't look to lawsuits about science. Imagine that. We don't go to lawyers to learn about medical information. I know that's shocking to you, but yeah, that's what we do in science.
So I'm a firm believer in asking those questions, but
Ruben, it's weird. What is it weird that there's aluminum in breast milk? Are you trying to ban breast milk, Ruben? Is that what you're trying to do? Think about that.
from the pediatrician's point of view, they can't stay afloat if they don't give these shots.
Yeah.
It's a crazy
Oh
system. I
my
hope that
gosh,
Robert F.
yeah.
Kennedy will
Again, guys, it's just nonsense. Just nonsense. Physicians don't get paid for vaccinations. Like, that is just not true. That's nonsense.
remove those incentives and actually offer positive incentives that are based on, like, how healthy are the children under your care? What if pediatricians got rewarded for demonstrating measures of health, not merely measures of what percentage of their
idiot.
children are following the CDC schedule?
Oh my
I
God.
agree with that, and I pray and I hope for that too. I too am a victim of bullying from a few pediatricians' offices, and so luckily there's homeopathic doctors. Luckily, and
Oh my God.
it's such a
What
noble
crazy.
job as well.
What a
And so
noble job.
We found a great one.
What kind of lip filler? What is the FDA stance on lip filler? Anyone know how toxic lip filler is, anyone? Do you think it's vaccines are more or less dangerous and toxic to you than the plastic that she pumped into her lips? Anyone? Anyone have any chance of idea of like what that is? Just saying. Just saying.
Those cities, so she kind of like walked through all the vaccines with us. And so I just want to share that if there are parents that are bullied out of their pediatrician's office, there's lots of holistic doctors. That
Well, but aren't the state boards going after those doctors?
Yes,
especially in California?
thankfully. Hopefully.
Homeopathic doctors?
Hopefully.
Yeah.
Yeah, hopefully, yeah.
And
Hell
a
yeah.
lot of them are very scared to speak up on their Instagram pages. They're scared.
I might want to wrap it up, Sarah.
going
Well,
up to
you're
podcast
a
app.
coward that sits in chat and you won't get it. You won't get into the box. So, how about you box it up, or you can just stay muted.
Asked a few, would you like to have vaccine conversations? And majority of them, they're very adamant.
Children's
They're
are now getting 80
scared.
vaccines. No, they're not.
So,
They're getting 80 shots
I hope
over
that
18
changes.
years.
Because I think parents really do want to know, but there's no answers. There's not a lot of answers.
Well, I've heard that Nicole Shanahan, who was Robert F. Kennedy's running mate, might run for governor. Wouldn't that be wonderful? to
Oh
have her?
God.
Yes. Oh my God. I think a lot of things are going to change. All right, let me go to our next question.
Make
I wanna talk
vaccines,
to you about
dude.
one
That
of
is
the
a exactly. Oh my gosh, that's a really good idea. No, Renee, put vaccines inside of lip filler. That's and Botox. So if you're getting Botox, you're actually getting a little vaccine as well. That's exactly, Envy. Yes.
papers, the autism prevalence. Would you like
Which one?
Oh, let's talk about
Yes, it
the-
is okay, Revel. Yeah, of course it is. That's okay. No, it's not. That is not the most ignorant comment you ever heard. God, I'm so sick of you guys just not boxing up. So you're just going to get muted until you freaking join because you're just so annoying in chat because you guys are such cowards. You're sitting here praising how brave you guys are to sticking up truth to power, and yet none of you are honestly getting into this chat and actually trying to like defend yourself. So it's wild to me.
the county and race ethnicity declining trends among wealthy whites. That one in particular.
Right,
What?
and that's probably the subject of the tweet that led you to
Ruben, I didn't, bro. There's a
yes,
thousand
because
questions,
I know
man.
the tweet went viral. I know that it went viral. So I'm very excited to hear your story of this.
Yeah, I actually
Oh, okay.
wrote some
My voice matters to the ears who listen. Your voice is poison. All right, well, guess what? You're muted now. And if you are so inclined, you can come up here and voice, and you can actually defend yourself then. But otherwise, you can stay muted. But if the aluminum is not active ingredient necessary for the vaccines, why not take it out? Oh, Ruben, that's a good question. It's called an adjuvant. So an adjuvant is something that helps the immune response to the antigen. Okay, so there's basically like a little cup action that the aluminum takes, and it helps keep that like that little training vessel to help your body train the immune system on. So it's like imagine if you're a punching bag. Okay, so the adjuvant is kind of like the ability for the punching bag to be, attached to the ceiling. That the aluminum is the ceiling, way that the training bag can be used. So it's a way for your body to better train on the antigen. Yeah, that's another thing. Yeah, it's a different. Yeah, it is a different type of like aluminum, but yeah, there's more aluminum in breast milk, guys. If you're worried about aluminum, then ban breastfeeding. I mean, it's crazy. People just don't understand.
notes on what do I want to say about that. And let me just consult what
What about
Well, I mean,
thimerosal?
first
It
of
was
all, this-
already removed, dude. It was already removed. So then, if you were right, then you would have seen a huge decrease in the amount of anti-vax side effects. But you don't. You don't see any of it. Why not keep it as a saline solution? Because they have to be preserved, brother, and you're going to get a better antibody response if you keep the aluminum in there. It's better for you. It's better for the vaccine. Hey, Renee, how's it going?
Hey, good. How are you?
Good.
I just wanted to say, I can see a really big difference in the kinds of questions that Ruben is asking. Sorry, not to
Yeah.
talk about you, Ruben, but I am, I guess. And I think that that's really important. Like his questions are getting better, and I think that those are really valid, and I'm glad that he's asking those. And I just want to say I'm seeing a lot more people in here that are asking questions. Go ahead and tap the guest, the little icons of the people, and have a conversation.
Yeah.
He really is here to educate us, because this is complicated stuff. We're getting our information from very different sources, and it's important to know how the science works. So that's all I wanted to say.
Agreed. Thank you, Renee. Yeah, it's way productive, guys. If you're
Yes.
anti-vax, it's way more productive just to have a conversation with you than to read through chats. You know, I mean, I'm not going to bite.
It's
don't
kind of
worry.
exhausting.
Exactly. And there's all these different questions, and it loops. You know, it's
Yeah,
frustrating.
exactly.
It's very frustrating.
Okay.
All right. Thanks, Renee.
Okay, kick
Appreciate
me
you.
out. Yeah.
This paper came on the heels of
Okay.
an earlier paper I had written on
Okay.
racial trends in autism using
Okay. I don't care about her
had been
race.
made, and I was
race
getting these queries
racism.
from
That's crazy.
strangers I'd never heard of, and I didn't know, were they baiting me? What's prompting all this?
Yeah, it did go pretty viral though.
Yeah, and so I guess the short answer to that is I did look into that issue a little bit, and for example,
Why did the CDC change its stance on vaccines and autism? Because of politics. Just did it because of who was elected president. That's why. It's not the science didn't change. It's the president of the United States and who he put into the head of the HHS that changed. It has nothing to do with the science. There's no study that RFK is linking to. There's no study that Trump is linking to. It's just a attack that they have against vaccines, all vaccines. So it's nonsense, dude. There is no study or reference that they have. They literally talk about, RFK is literally talking about that that is literally what happened, Ali. I don't know if you're trolling, but that is literally what happened.
California Department of Public Health puts
This is the study per author that we are listening to right now, who actually did the study that they're linking to, and she has no idea what the hell she's talking about. Can vaccines go bad? Yes, Ruben. Yeah, yes. They have the nucleotides and stuff can be denatured. They can the live attenuated viruses. They're just live viruses, man. They can definitely go bad. So yeah, absolutely. There's a lot of the technology for the mRNA vaccines is actually keeping them cold. So it's called in vitro transcription, when you make DNA into RNA, and that RNA needs to be chilled, dude. We're talking like glycerol, like sub-zero. It's really hard, and it's really important to keep that as cold as possible.
I'll bring it up right here. It puts out a website, something to the effect of, how is my school doing?
Yeah.
And then they have a system of icons that you have a green triangle for the safest schools.
Yeah.
And safest means that the vaccination rates are 95 to 100%.
Really?
Of the kids in that school following the CDC schedule.
Like
an orange down triangle is moderately vulnerable.
Yeah.
I love these terms. 90 to 90.
Think of how psycho this is. This chick this person is during the middle of an outbreak in Canada, literally downplaying the fact that measles herd immunity is less than 95%. Think about that, how dangerous that is, how insane that she is. How's it going, user?
Good. So you do know, Dr. Greg, that when you undermine people's opinions and you shun them, making their opinion null and void, or try and silence them, that's a main indication of a psyop. Right?
Okay.
So I would just inform you to
Oh no, you
do
found
your
me.
research
You
not
found me.
on
Oh,
not
no.
on vaccines, but on
Oh.
psyops.
Oh,
and when
no.
you try and silence the other opinion without
found
engaging
me.
in an intellectually honest discussion, that's an indication of a psyop. So you should
Okay.
go
No,
do
the
some
problem is
homework
just
on,
sticking in
psyops.
chat isn't actually productive. I'm much more inclined to talk to people if they're going to go in voice, And that's what it is. Sitting there and like as saying nonsense in chat over and over and over again just diminishes the stream quality for everyone. But people that come in, I'm basically trying to do exactly what you did, and you fell into my trap in the fact that I psyoped you into joining voice chat. So thank you for falling into my trap.
I didn't type too much in the comments, Dr. Greg.
Well, you fell into my trap still. So
well, good. If
thank
this
you.
is your trap to enlighten you,
yeah, so
the
enlighten
information
you.
you're spreading, and to engage in thoughtful discussion instead of
okay,
I'm right, you're wrong, she's insane, she's a crazy lady.
She is. That's what the reality is. That's what the reality is.
I was around during measles, and
who
you're doing a little too much, Dr. Greg.
Who?
I mean,
who's down?
Who? You?
No, the measles. What are you talking about? You were around during measles. What are you talking about?
That video.
Yeah.
Correct.
Yeah.
Was mentioning what?
She was talking about MMR rates dipping between below 95%. She was laughing about it.
Great, and you were
great. So you're okay. You're okay during this time that she was talking about that and cheering on less than 95% herd immunity. 2 Americans died. 2 American kids died from measles. You're okay with that? You're okay with Americans dying from preventable diseases?
Do you guys hear the psyop language this individual is
Can you say that? Can you say that you're okay with Americans dying from preventable diseases? Are you okay with that? Okay. I don't care. She's a bad mom. I don't care if she's a parent or not. She's a bad parent.
Mom.
Yes, she is a bad mom. Yes. Yes, because she's exposing her kid to undue harm. Therefore, she is a bad parent.
Dr. Greg, are you fallible?
Yes, science is too.
Okay, if science is fallible and you're fallible, who are you to say someone is absolutely certain that she's incorrect on any topic across the board? Instead, you say, hey guys, here's the reasons why I think differently. I agree to disagree with this lady. I don't think it's the best for society.
Because people are dying, dude. People are dying, and she's wrong, and she's pushing disinformation. Yes. Yeah, what's wrong with that?
People are dying, Greg.
What's wrong with that? So you're okay with people dying. You're okay with that. 4 million.
Am I
you're
okay?
4 million people die every year from actually, vaccines save 4 million people every year. Are you okay with that? Would you be okay with 4 million more people dying?
Do you know vaccines also cause people
to die? Don't.
Are you okay?
No, they don't. No, they don't. No, they don't. That's complete. Show me a proof. Show me proof.
Are you okay?
Show me proof of that. Show me proof. Show me proof of people dying. Show me proof. Show me it. Show me it. Show it. Link it. Link a study right now.
Look at this guy.
Link it.
Are you okay with vaccine injuries?
Wait, vaccine injuries or vaccine deaths? Because nobody dies from that. Nobody dies in mass from vaccines. That's just wrong.
Great. Let's change the topic. Vaccine injuries.
You literally started it. You literally no. Don't run now. No. Don't start. No. Don't run now. Don't run now.
Yeah, because
show me the evidence of all the vaccine deaths. Go ahead. I'm waiting.
Vaccine injuries.
No. Vaccine deaths. No. That's what you said. You said you were laughing about Americans dying, and you were laughing about Americans dying. And let's talk about vaccine deaths. Let's go. Let's see it.
Is a vaccine injury that leads someone to die a vaccine death, or was it something that was because a car hit them?
If it was so bad from the vaccine, it could be, yeah.
Yeah,
but it doesn't happen. That doesn't happen. That doesn't happen, dude. You do not have mass vaccine injuries.
Behavior.
Dude, okay. You already said that before.
If I was doing a psyop, Greg, I'd pay you. You seem like a smart guy. Hopefully you hop on board. Now...
Are you kidding me? You realize that RFK gets paid?
I would pay a guy on TikTok like Greg to go up and be like, "You want the kids to die? Look, shut up, crazy! You want kids to die?" Okay, that's not proper behavior. You're grown. Okay,
that's proper behavior.
Cause injury.
Okay. I'm sorry. I'll be very proper. I'll be very proper. I'm sorry.
Do vaccines cause injury?
I'm sorry.
Can we agree?
I'm sorry.
Classic.
Sorry, you wanted to talk about proper behavior. So I just wanted to.
Classic.
Are you okay? Are you okay?
Behavior.
Are you okay?
This is classic.
Are you okay? Sounds like you're crashing out, bro.
Let me go on mute.
It sounds like you're crashing out right now. Are you okay?
If it's the case, vaccines.
You okay? You all right there?
Dr. Greg is
that all right? I'm sorry, I can't hear you. You're crashing out. I can't hear you. What was that? I'm sorry. What was that? I couldn't hear you. I'm sorry. You're crashing out there.
Okay, do your sound.
Are you okay?
Yeah.
You okay?
Yeah, good stuff.
Anything else? I can't hear you. I can't hear you. Oh, so everything is everything.
You're a funny guy.
Everything is a
guy.
conspiracy with you.
it to
How original. Everything's a conspiracy. Wow, you're so how
Everything's
wow.
Hey, this is an indication of a psyop. Therefore, everything's a conspiracy.
Dude, you're crashing out so hard. So hard, man. Oh, dude,
Okay.
I can't. There's something
cause
coming.
injuries, Dr. Greg.
I can't hear you, dude, over the crying that you're having. All the crying. Are you okay? You okay over there? Is that okay? Are you okay? Do you have a baby crying, or is that you? Oh my gosh. Sounds like you got something to work on. You all right, dude? I can't hear you. I must have a mic broken or something. All right, next guy. Sorry. Oh man, someone goes change his diaper. So change his diaper. Sigh up. So lame, dude. So lame. I'm sorry, guys, that it's so rare that a scientist, a doctor, comes on here and actually pushes your shit in and doesn't actually coddle you guys for the nonsense that you spread. If you are here to ask legitimate questions, I am here for you. Legitimately. I will sit here and I will talk to you for hours, explaining to you how things work, how molecular biology works, how microbiology works. I'll be here for hours for you. But if you sit here and you just explain this away and explain all the stuff that I actually do, all the volunteering that I am doing of my time as a psyop, you're so bored. You're so boring. Unbelievable.
Oh, hello.
Hi, Gail. Oh, Heather, nice. Let's go, Heather. You got 3, 11:33, guys. Let's get it for Heather. In 3, 2, 1.
Hi.
How's it going?
I just wanted to make good. How are you?
Good.
So I don't understand why people will pick out the one study that goes against all the other studies to say, the measles vaccine is better, for example, or something like that. It's crazy.
Mm-hmm.
Yeah. And imagine if they lived at the time of the plague and things, do you think they would have the luxury of turning down a vaccination then? Or I actually think they're parasites because they have the freedom to say no to vaccinations because they know that the huge majority of the population is vaccinated.
Exactly. They live in a world that are free of the viruses, and then because the vaccines are so effective, and then they have the privilege to say, "Oh, what are these vaccines doing for us anyway?" And you're like, "Well, they've literally created a scenario where 50% of our kids used to die from vaccine preventable diseases or antibiotic related diseases, and now that all those kids are living, now we can go to places with 100,000 people in the crowd and not have to worry about it. Now they sit there and they say, oh, well, what are these things doing for us anyway? While these conspiracy people and this nonsense that they've pushed has never helped a single person ever. So again, these science and scientists are skeptical, but the idea that these type of contrarians, that these uninformed opinions have actually contributed to technology or anything is completely false. So it's just nonsense.
I have got one question though.
Sure.
I just wanted to know, do you believe that the COVID vaccine was sort of rushed out?
No, so that's a common misperception. Yeah, it did. It went through all the perceptions, but there's 4 stages that any type of drug during the FDA goes through, and it went through all of them. And actually, legitimately, Moderna and Pfizer actually showed more data than was normally given or asked for during the trials. The only thing and the reason why it was people call it was rushed was exactly Bill's exactly right, parallel staging. So basically normally you have like a stage 1 and then you have a break and then there's stage 2 and then there's a break and then there's stage 3. What they did is they created, and it was going so well, stage 1 was going and then they basically overlapped just the tail end of one into the other and then one into the other because it was during a pandemic. And guess what, guys? The COVID vaccine saved the lives of 2.5 million people worldwide. Think about that. 2.5 million people worldwide, and people want to talk about that it didn't do anything, and it did. We have those numbers and we understand it because people during the height of the pandemic, it was 10 times more likely that you died if you were unvaccinated. So, yeah, exactly, Mike. You're just completely wrong. It didn't kill millions. It is, Ruben. What was that? One more time.
What I'm confused about is twice. I've had COVID 3 times. I've got my vaccine. I had my booster shot, and I've never ever had a vaccination for flu or anything where if I've had a vaccination for flu, all I've got is a very mild sort of sore throat that's lasted 2 days. But I can't understand why I got COVID 3 times, twice quite badly, and now I haven't got my sense of smell back properly.
Oh, no.
And I don't understand. To me, a good vaccine should not sort of mean that you can get. I do work in a high risk environment, exposed to lots of sick people though.
Yeah,
I'm not
there
a
you go.
nurse though, but
Yeah.
I work with underprivileged children, and they're often not vaccinated and they're often sent to school sick. So, and we have to sort of give them comfort and things like that. So we're probably putting ourselves into their bubble. But I'm talking about the last 2-3 years. So that's the thing that bothers me.
Yeah.
And also that very, 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 I know what you say, the good totally outweighs, I 100% believe you, 1,000% outweighs the bad. But there was a very rare heart condition that can be fatal that was affecting some people who took the vaccine, but I think it was also affecting people some people's hearts were very vulnerable to getting COVID and having that heart condition and fatality if they didn't get the vaccine, because it's like a genetic vulnerability or something.
Yeah, it's called myocarditis, and the thing is that if you're worried about myocarditis, guess what? You are 580% more likely to develop myocarditis if you actually had COVID-19. So it's actually way, way, way more dangerous, the heart conditions with the actual virus and the disease than the vaccine. So basically, SARS-CoV-2 is the virus. COVID-19 is the disease. It's kind of like HIV and AIDS. Not everyone that gets HIV develops into AIDS, right? And basically having a vaccine doesn't stop that viral particle from like getting onto your nose or something like that, getting into your eye. So there is no way to stop that from happening. But once that happens and that virus gets into your system, now it's your body trying to kill that viral particle, right? And basically this has to do with the incubation period of the virus. So short incubation viruses like the flu, COVID, SARS-CoV-2, are those viruses only take about 2 days in order to ramp up so that it's spreadable and it can like cause the disease. Other ones that are like the sterilizing immunity vaccines like measles, smallpox, that kind of stuff, those are longer. Those are like 10 days. So basically, it gives your body a chance to actually mount that defense and actually create those antibodies so that, if you do get the measles, if you have the vaccine, that's why it's so effective, because it's just such a long incubation period. But what happens is that the short incubation viruses have a chance to decrease the severity. So you'll get SARS-CoV-2 in your system, but having those antibodies lowers the viral load. So then you spread less viral load to other people, and then there's less viral load to actually to make COVID-19 worse. So that's why it's so effective at stopping the death of COVID-19 is getting the vaccine. So unfortunately, it sounds like you have developed long COVID. So long COVID is a neurological disorder that we are kind of really understanding now. It's basically when SARS-CoV-2 infests like an organ system and your body is unable to get rid of it entirely. And that's why people develop like vertigo, develop the loss of hearing, taste, smell. They have tremors, they have dizziness, vertigo, all these type of things. And it's unfortunately we don't have a cure for it yet. We're just starting to understand it. One of the researchers, Iwasaki out of Yale, she's incredible. Really good research on that. And unfortunately, the more you get COVID, the higher severity of long COVID that you get, and the more likely that you develop long COVID. So that's why I still recommend, if you are in like a high traffic area, if you're going through public transport, if you're going through airports or something, I would probably mask still, just because of what you're talking about. You know, it's just going to keep you safer, get the people around you safer. And like, unfortunately, there is no cure for what you're going through. And I don't want to fearmonger you, I don't want to scare you or anything, but it could only get worse from here.
Okay, so I just want to support you on that, because the last time I had COVID was a year ago, actually, probably a year and a couple of days ago. And since then, at the beginning of this year, my workplace offered us COVID and flu vaccines.
Nice.
And it was the first year that I only had a mild sore throat. I didn't have to have 2 weeks off work or for flu, and then another 2 weeks for COVID. And I felt really, really healthy, because last time as well, last winter, I got bronchitis as well. So that was like a secondary thing that I got. But what does my head in is I just thought, I wouldn't get long COVID because I'd had the vaccine and a booster shot, and I was
Yeah.
really disappointed. And I think other people must be like that with me, but some people must take it a step further and think, well, that vaccine's terrible, it's no good, it does more
Exactly.
harm than good, and things like that. So
Yeah,
to
that's the
try to
tough.
think
It-
sort
it's-
of objectively about it.
It's unfortunately, I mean, SARS-CoV-2 is still a pandemic. HIV is still a pandemic. It is what it is, unfortunately, and it looks like we're kind of on this track as people are, okay with this, and doing less and less in order to stymie it, unfortunately. So, as the United States, the vaccine recommendation for COVID is being removed, so it's even harder to get it. You can't even get it in some states, and if you can get it, it's up to like $200-300, with insurance. So, it's awful. It's during a pandemic to actually remove the vaccine is so dumb. You can't even put into words. But thank you so much, Gail. Thank you for hopping in. I appreciate you. I really hope that you get your long COVID dealt with, and I'm really sorry that you dealt with that. dealing with that.
I've had headaches, and like I struggle to get through the week, and I usually have to spend Saturday in bed, and I get headaches and body aches still, but at least I haven't got it badly enough that I can't work, but
I'm sorry to hear about that.
That's all right. Thank
Okay.
you for having me up.
Well, have a
Thank
good
you,
one.
bye.
Bye. All right, guys. We got 4 people on the thing. We'll do, I think it was Empses, Jen, Sam, and then Matt. Hi. Hi, Empress says. How's it going?
I am well. I should be sleeping, but I am well.
Okay.
I really appreciate being able to pop in and listen to you when I do catch you on.
Thank you.
I'm not sure which coast you're on. I'm on the East Coast, so this
I'm
is
Pacific.
middle of the night for me. Okay, yeah, 2 a.m. over here. So, in answer to one of the things that the last person just said, one of the reasons why the vaccine is not as effective as it should be you know,
Hmm.
and I'm not anti. Don't worry. Um, is because we never got up to that. You know, what is it?
Herd
85,
immunity.
90%.
Yeah.
Right. Yeah, we never got up to herd immunity. So the virus got so many opportunities to mutate and mutate and mutate and mutate and mutate, and we don't have a different version of the jab for every version of that mutation.
Yeah, yeah. So the original alpha version of the
Right.
vaccine was extremely effective. It was 94.1% efficacious, which is insanely
Mm-hmm.
high. Basically, like the flu is normally like 60 to 70% on a really good year, but we actually got to 94% efficacious on that, and we had the chance if we actually did reach herd immunity there, like 95%. But unfortunately, I think around like 75% of people got the first dose. So it just wasn't enough. And yeah, you're right. So basically,
Mm-hmm.
Omicron and stuff like that have no herd for novel virus. Okay, yeah, that makes sense too. Yeah, but anyway, the point is, yeah, Omicron basically was so good at spreading because of that. It kind of wrecked it. But there was a point where it was like, it was the deaths from COVID-19 plummeted because so many people got vaccinated, that it was really doing a good job at keeping the COVID deaths down. So it was very successful.
Oh, I know. I was during C-19. I was actually working on a uh, C-19 technical team for my state Department of Health.
Oh wow,
So
really cool. Thank you.
yeah, so I saw a lot of the good information. I saw a lot of the bad that happened with the public.
Uh-huh.
I'm going to tell you, people who worked with the public during that time, we should have all been given like daily gift cards to
I agree.
go to the package store and just go get something to drink.
Yeah, my
Just
wife was works as a nurse, and a lot of the nurses still have like PTSD. It was gnarly what
mm-hmm.
happened, and
Yeah.
it was I don't I, it's really frustrating that there was no kind of like ceremony, no thankful, no I don't know, like parade, or nobody kind of recognized the public health workers, and then I mean they really got stationed,
They've been
at
burned
these
out. Mm-hmm.
hospitals where they were sent on deployment, and they weren't able to see their family for more than a month because they were going to quarantine afterwards. There was no vaccine.
Right.
It was truly incredible, and truly selfless acts that they did. And yeah, we love public health here, and we fight for it. That's why.
Right. So on that last note, and I'm going
Hmm.
to be quick about this so you can move on to the next person.
Hmm.
So during that time, I was really, really I'm still so proud of my state um, for what they did. Um, and I see how it's going to pay us
Hmm.
dividends now when we see these outbreaks in other states,
Yeah.
right? Because during, I believe, yes, during 2021, Connecticut removed the religious exemption for school age for children attending public schools
Yeah.
to avoid the vaccination.
Hmm.
So, if you want your child to attend a public school in Connecticut, you don't have the option of religious exemptions anymore
Good. Yeah, I don't agree with
at
that at
all.
all.
And there's only a handful of states that have this. It is California, Connecticut, Maine, New York, and West Virginia.
Hmm.
And I am so sure because I was looking at a map the other day. There's actually a map that you can look at, and you can go down to almost like zip code. I forget whether it's zip code or county, and
Hmm.
it will tell you what the vax rate is in each of these areas. Um, and we have herd immunity, but we're seeing breakouts in other parts of the country, and
Hmm.
I'm fairly sure if we start looking to see which states have the breakouts, it's not going to be those states that require it.
Yeah. Yeah, hopefully not. I mean, there's travel and everything, but yeah, I agree with you. I mean, vaccine mandates in the United States, the friction is in our society is getting it for public school, right? That's the idea. Is that
Right.
before public school, you have to get it, and private school and homeschooling is too expensive, so people will just get vaccinated. But there is other ways of doing it. You know, like we actually read a paper, and we were talking and doing an analysis of other nations and stuff. In Europe, for example, they just have you pay a fine. So it's like you pay, $10,000. I think it's less than that. I think it's like $100 or not. No, it's like 500 to like it's really small. It's really small. And then in Australia, they actually tie it to your child tax credit, which I think is a good idea. So basically, every child, you don't get your child tax credit. You don't get your, it's $8,000 a year that you would not get if you were not vaccinated your kid. So basically, get your kid vaccinated, you get $8,000 a year. So it's a good. I like that idea. I like the idea of not punishing people for getting it. You help people with money, right? That would be a huge benefit, so that they could pay for preschool, that they could pay for TK, they could do spend it however you want. I like that idea of and it's sooner. That benefit, you give it to them so that they can spend that money how they want to take it. That would cost a fortune.
I mean,
Ruben, do you understand how much the increase in healthcare costs for everyone is going to be because of these vaccine preventable diseases, going around, brother? It's going to cost everyone 10 times that amount. So $8,000 a kid is not that much. So,
right.
yeah.
But I think the penalty or bonus actually needs to be higher than that, because there are some communities where they'll be like, $500 is nothing, $2,000 is nothing. Because I can say that because of where I live, and I see certain communities that, especially those who have more money, that some of them will opt to still forego the money.
Yeah, exactly.
So, but I just wanted to throw that out there in case there are people who are thinking, like, how can I help make some change in my community, so that other kids are getting vaccinated. You know what I'm saying?
Yeah, for sure.
Maybe push for new legislation in your state, and if they do what my state did, because they made it so that they left 1 year, that last year, that you could possibly have an exemption, a religious exemption, but you already had to have at least one child in school with the religious exemption, and that last child who would get a religious exemption would have been an incoming kindergartner. And you had to get your paperwork in by, let's say April 15th of the school year prior, and people just weren't thinking about it. They overlooked it. So you got down to the last few days of the school year, and now you have parents talking to the school, talking to the schoolers. Well, I'll be bringing so and so next year. I just need the form for the religious exemption, and the school nurse going, "Oh no, sorry, you're not going to be able to do that. The deadline already passed."
Yeah, it's a good idea. There you go.
And it worked. The school nurses were so happy to just pass them over to the Department of Health.
Like nonsense.
Like, oh, sorry, you'll just have to. I mean,
there's no religion that causes anything about vaccines. They don't talk about that at all. So it's nonsense.
No.
All right, well, Empress, thank you so much for coming on.
To pass that along.
Yeah.
Thank you. I appreciate what you do, especially since I have been diagnosed with lupus, and I know too many people on this app who have autoimmune disorders. I've been diagnosed with lupus since before I turned 16.
Oh,
so
wow.
I've lived 2/3 of my life with autoimmune disorder. And so I know how important this is. So I appreciate you. Appreciate you.
Thank you for saying that. I appreciate you. Thank you for saying that. Have a good night. Bye.
Have a great night.
All right. So we got Jen. Okay, Jen and Sam, then Matt. And then Miss Kate. Hi, Jen. How's it going?
Pretty good, I guess. How you been?
Good. Good.
Yeah. So I've been up here a couple of times, and
Mm-hmm.
we talked about how I used to be anti-vax.
Mm-hmm. I remember.
And that my youngest wasn't vaccinated until he was 2 years old.
Mm-hmm.
That guy that was up, that was when I decided, oh, I'm hopping up there now. Because he kept calling you a psyop
Mm-hmm.
and criticizing the way that you were communicating, when you were saying, oh, you want more people to die from these diseases. You want people to die from these diseases. And he was criticizing
Yeah.
you for that communication. That's literally how anti-vaxxers sound, though.
Mm-hmm.
They're the ones who make those arguments too. It's all like high emotion, and but for them it's fear mongering.
Yeah.
And so I found it kind of funny, not funny, that he was criticizing how you were communicating, but you were doing what they've been doing for 20 plus years.
Mm-hmm.
About vaccines. You were just throwing it right back at them. How does it feel? Like
Yeah,
to
I
have it
think
thrown back at you.
the
Except in this case, it's accurate.
yeah, we've looked at a lot of the Baja websites recently, trying to, because we're doing makeamericavaccinatedagain.org, and just the amount of websites that have so much fear when you go there. They're just talking about like that there's these evildoers, that the pharmaceutical companies are coming after you, and like all this kind of just wild nonsense, man. And it's just the amount of fear and energy, like just emotion in their websites, how the language they use, the colors they use, it's so over the top.
Yeah, I remember it well. So during COVID, I talked a lot about how I used to be an anti-vaxxer. I post a lot on TikTok
Mm-hmm.
About it, and because what I was trying to educate people about at the time, because a lot of people who were complaining about the COVID vaccine were saying, I'm not anti-vax, I'm just anti this vax.
Exactly.
And I was trying to explain to them, but the propaganda that you're receiving about this vaccine is coming from the exact same people who have been peddling misinformation about all vaccines for decades.
Exactly.
And,
Exactly.
And that's what, and I was like, and I know this because I was in it.
Mm-hmm.
And, I did that during COVID. I haven't been super involved except for like hopping into your live every once in a while, over the last few years. But then RFK said that vaccines cause food allergies. And yeah, I'm coming back out to talk about it again, and I'm going to be posting a lot of content about it.
Okay, cool.
Because when he said that, I was like, oh, then why did my youngest get food allergies before I ever vaccinated him?
That's a good point.
Because I know those anti-vaxxers love their anecdotal evidence. So,
Exactly.
yeah, like I said, my youngest was not vaccinated until he was 2 years old. He had food allergies while he was still nursing. I know this because when I consumed milk, he'd get a rash on his face. When I stopped consuming milk, his rash went away. He still has a milk allergy to this day. Okay? And he also has a peanut allergy and a tree nut allergy. All of these he developed before he got a single vaccination.
Wow. That's interesting.
So, riddle me this, RFK.
Yeah.
Where the hell did his food allergies come from then?
Yeah.
I know where they came from, but I want him to answer this. I want the anti-vaxxers to answer this.
Yeah, and again, they say, I mean, if it was logical, they wouldn't have these arguments, right? I mean, it's the same thing with, they don't think that long COVID exists. It's a vaccine injury thing. you know, and then there's people with long COVID that have never taken a vaccine. It's like it's
Yeah.
so easy. It's so easy to bat these things down, and it's like it's just it's wild. It really takes. Okay, Matt. You're third in line, so you got time, dude. It's 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 exhausting because it's just it said they say things that conspiracy is an easy way to explain a hard thing to understand, right? And so it's like it's just it's a brain worm. I use that specifically, but it's a brain worm that just gets in, and you just kind of like you instantly can just be like, oh, of course, duh, and it's just like that's like intuition isn't necessarily the best way to understand the world. I mean, it's just not that's not how it is. So
Yeah, absolutely. And there was one thing also with the one woman who said that she was disappointed that the vaccine didn't work better for her.
mm-hmm.
And the thing that it made me think of was, I was 3 times vaccinated, and I got Omicron. That was the first time that I got COVID. So I'd had 3 vaccines by that point, and I got real sick. And for months after, like, I would be short of breath, and I needed a pulmonologist and all of these new medications and everything. And it never once occurred to me to say, well, that vaccine didn't work. The thing that it made me think was, yeah, without the vaccine, I would have been, I very well could have been in the ground.
Exactly.
And that's when people say, well, I still got really sick even though I got the vaccine, and they're angry that the vaccine didn't keep them from getting sick, or that they didn't have mild symptoms. And my thought is, it would have ended your life.
Exactly. Yeah.
Had you not been vaccinated. Like, you got so sick even with the vaccine that you're having all of these issues.
Yeah.
Do you not see? And I'm not trying to criticize her, because I know that she's still like supportive of the vaccines and everything like that. But like, to me, that just seems like the obvious answer. Is that without the vaccine, you might have been hospitalized. You might not have survived.
Exactly. Yeah. It happens.
And
yeah. You definitely can, and you definitely can see whether or not the vaccine made it worse. Absolutely, you can. And you can test your immune system, but if your immune system isn't primed to attack it, then it has no defense mechanisms to defend against itself. So that's the danger of getting a viral infection versus a vaccine. A vaccine isn't a living virus that's going to. So viruses aren't alive, but an actual infection that will cause disease. Vaccines don't cause disease, guys. That because viruses do, and viruses are real. That's the thing. So, yes, you can, OJ. You just the epidemiology and science. It can. I'm sorry, but that's just not true. Okay, thanks, Jen, for coming in. I really appreciate you always coming up and speaking truth. We might make a call for like anonymous anti-vaxxers that have been swayed in the future on makeamericavaccinated.org. We might be like doing something like that. So, to keep an ear out. So we appreciate you, and we
Absolutely.
your testimony.
Thanks for letting me know.
Okay, cool. Thank you. I have a good one. Bye.
You too. Bye.
All right. Sam's next. Yeah, OJ, you just don't know about the science, dude. I'm sorry. No, yeah, OJ, except for the ones that didn't survive, dude. That's the thing. So, yes, everyone now survived, the ones except for the people that didn't. And we're talking about 1.2 million Americans that died. So and we don't want that to happen. And there's 300,000 people that died because of vaccine hesitancy that would be here if they got vaccinated. So that's why you know. Yeah, you're another one of those cowards that refuses to get in voice chat, dude. So it's like you're boring. You can get in voice chat if you want, but you're just annoying. Sam, how's it going?
Hello, Dr. Greg. I'm very good. How are you?
Good, man.
Yeah. So I just had a question, basically.
Mm-hmm.
So I used to be a heterosexual. Then I got a lot of the vaccines,
Mm-hmm.
and then like a week later, I just kept getting these thoughts, gay thoughts. And ever since then,
What's wrong with you, dude? Why is this how you spend most of your time? You sat here
I've
in like
just
the queue
been,
for like 30 minutes, dude. Like, are you
I've just
okay?
been like sucking everything in
That's sweet.
sight.
I'm glad. You and Trump, huh? I guess that's you and Trump the best friends. Is that? Do you ever have to like fight off Trump? Because he's trying to get there too.
To be honest,
Yeah, you
I
probably
probably
would.
would
Yeah.
do Trump.
So here you are, like sitting in this live for 30 minutes, just on this queue, just to like troll like really badly, and now I'm clowning on you, and you look really dumb. So that's like, how does that feel? Pretty bad, huh? Yeah.
To be
Yeah. It
honest, like
sounds
I
pretty
kind
bad.
of
Yeah. Looks pretty bad for you, bro. All right. All right. All right. Matt's gonna come right back. All right, Miss Kate. Hi, Miss Cake. How's it going?
Hi, good. So there's somebody in the comments who's just really, really sure that doctors got all these kickbacks for administering vaccines.
Yeah.
And he doesn't even realize that doctors aren't even the ones who administered most of the vaccines.
Yeah.
If you hadn't noticed, it's a lot of pharmacy techs at the CVS that
Exactly.
administered the vaccines, and they're paid hourly. They didn't
It's a
get
good
any
one.
bonus check.
Exactly. You don't need a prescription in order to get the vaccine. It's just so boring, man. These people are, their conspiracies make sense to nobody but themselves. It's wild to me.
And the trouble they'll go to make up just one more BS thing about it. And it's like, no, the vaccines just were like really good, and they probably would have been even better if more people had gotten them.
Yeah, exactly. If we would have gotten vaccinated to the point that we could have, stopped Omicron, then there would have been an incredible breakthrough. But unfortunately, we didn't. So, yeah, it sucks.
And mRNA is not new technology, and billions, like with a B, creatures upon this earth have been given mRNA vaccines.
Yeah.
And are doing just fine.
Yeah, it's crazy. Yeah. It's the next generation of molecular biology and gene therapy tools, and it's basically, if you have cancer and you're gonna, the next generation of anti-cancer tools, it's gonna be mRNA and lipid nanoparticles. So that's just what it's gonna be. Thanks for coming up, Miss Cake. Appreciate you. All right, Matt's back. What's up, Matt? How's it going?
Hey, Greg, how are you?
Hey, dude. Good, man.
That's good. I actually just wanted to come on and say I really enjoy what you do. I don't necessarily agree with everything, but I actually love that you have open debates, and I think it's fantastic. This is what should have happened from the start of the pandemic, and I've kind of been in your comments a bit saying, I was kind of against this jab. I was like the lady said earlier, I took every other vaccine, and this one I was a bit cautious. And I think a lot of it had to do with the messaging and the fact that people wouldn't do debates like this and have, intellectual conversations so that everyone could understand what was going on. And I'm in Australia, and in Australia, the messaging was really bad. One of our first vaccines that came out was I can't actually remember the name of it now, but the vaccine that came out first, people were getting blood clots.
Johnson & Johnson. Johansson.
Yeah, so in Australia it was AstraZeneca. So the vaccine came out, people started getting blood clots, but it was very few, but the news sensationalized it, and then they broke down and wouldn't let people have conversations about it. And I think that pushed people towards that anti-vax narrative.
Yeah.
And I've actually learned more just coming on and listening to what you've got to say. Again, I don't agree with everything because I'm a little bit of a hippie and I like natural health products. And
Yeah.
I'm all about, I think we should be living healthier lives. And I'm sure you probably
Sure.
agree with that anyway.
Yeah. Yeah.
Living healthier lives so there's less disease around. But
Mhm.
I just wanted to say thank you. I
Thanks,
love
man.
your page. Sometimes I cringe, sometimes I laugh, sometimes I think when you were dinging that guy off before, I was a bit like, that's a bit harsh, but people come on here wanting a fight, and I see that as well. And, you
Yeah.
know, I was down that conspiracy rabbit hole, but I'm more of a moderate person, and I've come back to more center.
Nice,
And
man.
I just
Welcome.
love the fact that you've got this page here and people can debate. So I just wanted to say thank you.
Thank you, brother. Thank you for saying that. I appreciate you. I remember you from like the comments and everything, and it's been yeah. I you know, people in good faith that are genuinely trying to ask questions and stuff. I'm here for all the time, and it's just the people that are trolling or trying to yeah. It's just there's a point where if I don't like fight back and clown on them, then it's just like it's boring for me. and
I would be.
yeah, you know what I mean. And it's like and it's unfair to like it's not cool what they're doing, So they need to say that, and I think that it's I think it's healthy if they're gonna accuse me of being a paid shill, then I can clown on them a little bit too, because I really am not paid, guys. I'm paid $2.50 on this live here. I don't.
And you've got conviction. You've got conviction in your beliefs. You've done a lot of
Thanks,
study.
man.
You're actually obviously a very smart person. And I think I just saw someone, just one thing I wanted to mention. Someone mentioned in the comments that being healthy didn't stop COVID, but I kind of beg to differ that a healthier template in your body, like where you're starting at a healthier spot, I think that while the viral load, was different in different people and vaccines helped people and other people had adverse reactions, even though that was quite low.
Yeah.
I think having a healthy base is a really important thing when it comes to catching any disease or having any comorbidities or anything. Once there were comorbidities in place, people were dying at a higher rate. So I think we should all try and have a base of health and then move forwards from there.
Yeah, man, for sure. The people that that had died the most were the highest comorbidities, right, during COVID. So, it's well known, and people that were obese, that were older, they're going to they would have died the most, just like how any disease. So,
With anything, yeah. So my only thing is stay healthy, everyone. Thanks a lot, Greg. I won't stay on board for too long, and I don't need to debate anything because you'll probably kill me. Have a really good day. Enjoy the rest of it, and I'll always pop in and say hi.
Thanks, brother. I appreciate you. Thank you. Have a good one, man.
See you, man.
Appreciate that, man. I remember Matt. He came out. He had a lot of really good questions when he first came in, and it was good. Yeah. People that are healthier, people that it matters. It matters. It's a lot of healthy people did die from COVID. Absolutely. A lot of young kids, hundreds of young kids did die as well. But it's also like the average age of people that died from COVID, which is that paper that person's referencing in the comments. One, it's a paper from September 2020, guys, and it did get eventually published in Environmental Health. But again, like, what kind of freedom and what kind of liberty do you have in a society where as soon as you're 65, you're deemed to be okay to die? That is disgusting. And especially when we have the technology and we have the ability to help and prevent these people from dying, we just choose to say no. Like, are those 65-year-olds consenting to be basically euthanized by society? That's just crazy. That's insane. So, well, Guts, you should just join up then and say what you mean then. All right, Stevie's next. Hi, Stevie.
Hey, I'm so happy to hear you talking so positively about vaccines. I spent most of my 20 years of nursing in the ICU, and did go back to the ICU during COVID.
Mm-hmm.
What I really want to talk about right now is this bill that decreases nursing profession to a non-professional where nurses, occupational therapists, physical therapists, NPs, PAs are no longer going to be able to receive federal funding in order to proceed in their
1 second.
pursuit.
1 second. Let's 692 political actions. 3 emails by bare necessity, guys. Super important. 3, 2, 1. Nice. Good job. Good work, guys. She went to action.drgregshow.com, and we have templates for emailing and calling state senators, state representatives to try to stop these 423 anti-public health bills that are attacking vaccines, public health, quarantine measures, that are basically attacking the ability for us to stay disease and virus free as a community. So go to, if you've never gone there, guys, just check it out. action.drgregshow.com. It's a Google Doc. It is amazing. It is all the templates, everything is there for you. Okay, so this bill is very odd. They put it into the omnibus bill that Trump passed, and it blows my mind. It basically it's considered nursing a professional thing anymore, so that it basically limits the amount of money that you can get from student loans. So it's crazy.
So now the only loans that will be available would be private loans, which would be high interest loans.
Mm-hmm. Yeah, it's honestly shocking to me that they would put that in. I would hope that it would be rescinded or another bill would be passed, because like that has to be an oversight. But I guess it's not. I have no idea. The only thing I can think of is that they're trying to push people into trades and get like more non-medical professionals. I have no idea why they did that. It's genuinely mind-blowing.
It's concerning, for sure, especially in this age where we're heading into, a lot of the boomer people that will, we're going to head into a nursing shortage where people really, really need nurses.
Yeah, exactly. There's really nothing that nurses have done, or there's nothing that physicians have done in order to do this, to deserve this. It's just it's insane to me. I don't get it. I don't know. It's baffling to me.
Well, then I guess the next question is, legislatively, what do we need to do in order to preserve that?
I mean, it's a federal program, so you would need to pass counter legislation or have states come in and somehow supplement or decrease the tuition costs somehow. I have no idea. It's very tough. Yeah. Yeah, it's a hard question, but thank you so much for addressing it. Yeah, no problem, Stevie. I'm sorry about it. My wife's a nurse too, and it's just she's ending her DNP right now, so it is it's a question for us that we have to figure out too. And I'm going to check it out. I'll check it. I'll keep checking it. Appreciate that. Thank you so much. All right, see ya. Thank you. Canned K. The matter of fact is that much of the foundations of what we know of pre and neonatal diseases and their prevention comes from some of the very unethical studies. Okay, and it seems like this lady's ethical standards are those of Dr. Manjean. I don't know who that is. Some of the public acknowledged the sacrifices of the healthcare community in the only way we really could during COVID. The 7 p.m. nightly recognition on porches and balconies across the world. Oh, okay. Yeah, it seems like not enough, I feel like. But yeah, I do remember that now. I do check chat. I'm just not, sorry guys, when I'm doing the discussions, it's not on top of mind, but mangly. So I'm here. I'm there for your YouTube chat. I'm there. I'm here. Tess of the Irish.
Yeah, so I'm
Hi,
in
Tess.
Texas. Hi, I'm in Texas, and we're basically a lost cause here.
I hope not. I mean, you're not.
No, I'm not. I'm one of the few sane. There's so many that I'm around who are just like, oh, it's so deep down the hole. And granted, yes, I used to be AV, and it was.
Oh wow.
Oh yeah. Now I came up like a couple weeks ago on a live with you, and I talked about I was so deep that I was harassing people, I was threatening people, was on the Facebook forums, all that stuff, and I was one of those awful people, and I was adamant that I was going to prove the experts wrong.
Okay.
I had to, and I was right before we started to get ready to have a kid. I knew I was going to not vaccinate at all, and so I took all the paperwork I had. It's like 2 binders full, and I made appointments with historians and oncologists, and I mean it was actually like 1 per field. Pediatrician, my GP, etc. And we sat down, and I had no idea how genuine they were, but like there was several that they said, okay, well, here's this journal, here's how you go through it,
Nice.
etc. This is what this means, this is what that means. And as I read more into it and took the journals with me, some other doctors would say, well, here's how this relates to this, and here's how this relates to that. And it started kind of clicking, and I'm like, okay, but still. And then, and my mind wouldn't fully change until I had no idea too. One of the professionals, I have across the street from me. I had no idea his profession. Our neighbor, he's a immunologist.
Oh, nice. There you go.
So he specializes in like farm animal immunology, but still immunology. And then, but what really did it for me was when my mom told me about chicken pox. I was adamant, okay, I'll get this vax and this vax and this vax for my kid. I'm not doing chicken pox though. I'm gonna let her go to a chicken pox party. And she said, no, you have the chance to get that vaccine. You did not. Your sister did not. I was like, okay. I remember I got chickenpox. I got it on my 6th birthday.
Yeah.
And my sister got it as well, but my sister only had like 4 or 5 spots on her. It wasn't bad. She ended up, when she's 4 years younger than me, about 3 or 4 years later, she started school. She got exposed to chickenpox, but she got shingles. And I had no idea, but she ended
shingles
up
at that young age? Wow.
Yes, she ended up going to the hospital for about a month.
Oh my gosh.
It was that bad.
Wow.
She's like, because she had already gotten chickenpox, she got shingles. And she will have to have the shingles vaccine. My sister actually just got revaccinated. She's 38, got shingles vaccine like 2 weeks ago. So it kind of changed my whole worldview on, okay, I thought this one was going to be safe.
Yeah.
It's not that easy when you start looking into it. But
it's dangerous. Yeah, it's tough.
Yeah, and so no, I was actually coming on to ask. I'm gonna go on your website. I really appreciate the work you're doing there. That's awesome.
Cool. Thank you.
But I was gonna ask, is there any? It's getting so hard to even talk about vaccines here in Texas. And just going out in a mask, kind of get the side eye, get some shit from people in our town and whatnot.
Yeah.
Going up to the pharmacy here, the pharmacist is okay and nice. it's that when you walk out, you get the side eyes and the looks, and part of me is like, okay, I'm gonna go to another pharmacy out of town.
Yeah.
So, yeah, I don't know. I don't think it's a question even.
Yeah, guys. I mean, if it's a place where sick people are going, like pharmacies and doctors' offices, it's always a good thing to vax. I mean, they're not mask. It makes sense because that's literally where sick people go. So you want to protect yourself where the sick people are spewing their germs. So I was trying to think about it. I was actually thinking about like the whole personal freedom, nonsense that people say, and it was like, it's a crime to actually spit on someone, right? It's assault. But how is it not? But how is it okay then if someone is spewing their germs and their disease on you knowingly? That's not considered assault or some type of at least like social harm that that's unacceptable. You know what I mean? It's wild to me, like how spitting is so bad, but knowingly spreading disease is, oh yeah, it is what it is. You're like, how is that okay?
It's no big thing. Yeah, it's no big deal.
Yeah, it doesn't make any sense to me. Like, it seems like, like what's the freedom argument for spitting on someone? You know what I mean? Like, don't infringe on my ability to spit anywhere that I want. Like
I have a right to life, liberty, pursuit of happiness, right? Life, if you're getting your diseases on me, I'm not going to have that great of a life right now. Okay, you're taking away my right, my personal health right. So, back up just a bit, please.
Yeah.
But yeah, we're going on a plane for a winter vacation at the end of Christmas because, winter break.
Yeah.
And guarantee you, we're going to France, but we're gonna be masked up the entire way because
dude,
that many people in an airport, especially around
you want to get sick.
Are you kidding me?
You don't want to get sick. Why would you want? You're spending all this money and time on a vacation. Why would you want to spend it sick the entire time?
Well, on top of that, I want to make sure when we come home, as much as my kids detest it and hate the thought of it, I want to make sure they go right back into school.
Yeah, exactly.
So they can learn these critical thinking skills that lots of AV don't have.
Yeah, exactly. Well, Tess, keep up the good fight down in Texas. I appreciate you. Get back at all the people that are living around you. The action. Check it out if you haven't gone there. And
will do.
Yeah, thank you so much. Stay strong. Okay, we are your people. We are your community. So hang out with us.
Much more. Thank you.
Thanks for being here. See ya.
All right, bye.
Matt, I saw your question. It was like, do you think that education and transparency would help convince anti-vaxxers? And prior to 2024, I would have said that, but my theory of the case right now is that people are living in different realities because of AI-driven social media algorithms, that everyone is kind of seeing the world in which they engage the most. So if you are a skeptic, you like conspiracy theories, basically the algorithm is understanding that and pushing you that information, right, about whatever conspiracy that you would want, and whatever the conspiracy you get involved with, you interact with the most. And once you have, confirmation bias. And then once you are done and you stop interacting with lab leak conspiracies, now they're going to throw you some flat earth conspiracies, and there you go. Now you believe flat earth. And so the problem isn't so much education or transparency of the information, because all that information is out already, right? All that stuff is all there already. Maybe science isn't communicating that well enough, which is what I'm trying to do here, right? That's why I'm a science communicator, trying to tell you guys what the actual science is and say when you're wrong, or if you're wrong, kind of thing. Thank you, Bare Necessity. Appreciate you. Why don't you allow debate? I'm literally... Hi, I'm Greg, and you're on TikTok right now, and you're watching me. This is literally... Welcome. This is, I don't know if you are having an existential crisis, if you're clawing yourself out of a K-hole right now, disassociated so much that you are now coming to reality that you are a mammal living on Earth. Welcome. I am your trip sitter tonight, and thank you for being here. You have a life worth living, and we open the panel. I don't know. Are you okay, dude? We just literally did the whole thing for the last hour. That was the whole, it is open. There is, no, you're right. You're right, dude. I'm so scared of you. I'm petrified. The other thing was someone was linking that paper talking about the death rate of 0.86%. Like, okay, I mean, like 1.2 million people died of COVID in the United States, right? And we have 380 million people. So that is less than 1% of people, right? So why is that bad? Well, that's bad because a lot of those are preventable deaths, right? That is not okay. Like in a society, we should want people to have an improved quality of life, not one where you are thrown to the wolves and shown that your life doesn't have any meaning if you hold the criteria of being older than 65, immune compromised, born in a body that doesn't have the capability of having an immune system, or have the genetic dispositions to have cancers that can make you immune compromised, and you're on anti-cancer drugs, or all these. It's not okay, and that's what eugenics is, by the way. It's not okay to live in a society that perpetrates that. I don't pick and choose. Well, then, Guts, if you agree with me, then this is exactly why I prefer to have these conversations in voice, bro. I mean, this is the problem. I understand that you're really active in chat, and I appreciate you. Thank you for doing it. But it's exhausting having these conversations. It's hard to understand the nuance in text. The Kool-Aid Money found it. What's up, dude? How's it going? Are you muted? I can't hear you. I can't hear you. Are you signed into a Bluetooth speaker or a Bluetooth device that's not around? Maybe try disabling all your Bluetooth devices. All right, I'm going to give you 10 more seconds. All right. It's all right, bro. Try it again if you want. All good. Okay. It's all right, guys. Okay, can we do the 8 more heart me's, please, just so that we can get the next live goal up, please? Thank you. There's 142 of you in here, and the goal is only 50, so please, just 8 more, please. I appreciate you. Let's do shout outs real quick while we're doing here. Thank you guys so much. I appreciate all the support. Pfizer is, it's less money this month, so it's like it's rough. Thank you guys to all the last superfan. Thank you, Efon. Appreciate you so much. Ruben, thank you so much, brother. Thank you for the gifts and stuff. Ruben is my number one anti-vax fan, and I appreciate you being here, man, for real. Bill, thank you. Envy, thank you. Renee, thank you. Neek, Helen, Miss Cake, thank you so much. Thank you, Bill. I appreciate that. Guys, number one, Bare Necessity, the number one liker. She is amazing. She is a leader in the community in more ways than one, guys. She's an awesome number one in actions, by the way. She actually spurs her local friends group to do actions as well. It's absolutely incredible. User 8007, you're awesome. Thank you for the likes. Thank you, Renee, Tess, NB, Helen, Courtney. Thank you guys so much. Thank you to the Patreons, Mrs. Dr. G, Ado, and Call Me Nest. Thank you guys. Thank you to all the super fans. And you can get involved by going to action.drgregshow.com. Check it out. Also, guys, we got merch. We got Make America Vaccinated Again merch. You can get your shirts in. Can we get three more like the heart things, heart me's? Can I get the hearts? I hate asking for this stuff. I'm so bad. People DM me and they get so mad. There's so many people mad at me for not doing this more often. Thank you, Bill. Thank you, brother. Kool-Aid, I was literally talking to you, bro. I couldn't hear you at all. Thank you, guys. All right. I didn't mute you, dude. I didn't mute you. I don't do that. Well, now Ducray muted you. Now Ducray did mute you. So there you go. And you don't cross Ducray. So that's decision's hers. So you know what I mean? That's the queen bee around here. I can't mess with her. Yeah, Ducray. I think so too. Okay. All right, guys. So, all right. Okay, so I'm kind of... All right, guys. I'm going to say I'm making the executive decision that she is kind of saying the same thing for another 30 minutes. And one in the chat to move on and say that an hour is long enough and that we can kind of move on from this. Okay. Yeah, that's what I'm feeling too. Okay. All right, so we can respond to something else. I want to talk to something else, guys. I want some other content. I do love the debates. I love the content of we have to do the GeoGuessr for today while we switch. But I wanted to talk about and I want to react to Climate Town.
Folks, we are currently
Climate Town is an incredible YouTube channel, guys. If you're not aware of Climate Town, please subscribe. Please, Bear. I skipped that entire section because that was crazy. That I couldn't believe that she did that. Will you post the reaction on YouTube? Yes, Juliana. Every single archive of every single show that I've ever done is actually on YouTube. I'm actually streaming to YouTube right now. So we do every single live, every single time on YouTube. So you can go back to the last day, and I have the archives. I have everything all there with chapters, so you can go through and you can pick it out. So it's a good way to catch up. You know, if you don't want to take a break from TikTok, social media apps, mental health breaks, I totally appreciate that and I support that. So every single stream, every single time is all up on YouTube, guys. And my best of talks are in the video. So if you go to the live chapter, here, let's just do it right now. drgregshow.com. What's this? What's this thing? Oh, watch it not come up. That'd be embarrassing. Here we go. Oh, wow. That's a cool t-shirt. Anyone see that? I've never seen that before. You go scroll down to YouTube. Saw you on YouTube. Not funny. Anyway. Subscribe to... I guess can I subscribe to my own thing? No, it doesn't. Okay, so we are live right now. That's the thing. And then there's these tabs right here. So there's videos, and these are all my... this is a really good conversation, guys. This is a really good one, I thought. Lab leak theory versus science. It's a really good one. It only has 6 views, so check it out. I would go. That's a good one to. That's a good one to send your friends. If you're like, what is this? You should say like, hey, oh guys, get it in before the last thing. Okay, and then live here at the end here, boom, and then this has like all the live shows. So every single show, Every single one. That's all here. So, that's it. Anyway, so I wanted to do, let's do GeoGuessr, a fresh GeoGuessr, refresh. And then, nice, guys. All right. Nice. We did it before midnight, too. You guys are awesome. Let's go. All right. So I wanted to do this, and then I wanted to do another one. I know. I stream every night, Gail. It's too much. I need to stop at some point. I don't know. Okay, guys. Cool. So now we put up a rose one. I'm learning how to do this, how to TikTok. Everyone's telling me how to look TikTok. Okay. All right, guys. We have GeoGuessr now. All right, guys. You ready? Here we go. Oh, nice, dude. You guys are awesome. Whoa, no way. Dude, you guys are incredible. Yo. What? No way. Let's go. Y'all are too nice. What? What? Y'all are incredible, dude. That's how we should have done it. Oh, thank you. Thank you, guys. Oh my gosh. I should have done this more often. What was I thinking? Let's go, dude. Dude, that's awesome. Let's do it. 1,000 roses. Iris, no, that's pretty much a block, dude. Yeah, that's gonna be a block for sure. Thank you. That's the exact opposite. Dang, guys, thank you guys so much. Okay. Okay, let's do GeoGuessr real quick. Okay, are you guys ready? I'm not gonna pay attention to chat. Okay, so I'm just gonna, this is you guys can talk in chat, say where you think it is. Okay, and then we're gonna talk about it later. Okay. Boom. Here we go. All right. Ooh, weird looking. Whoa. What? Oh, guys, that was not me. Oh my gosh, how lame is that, dude? What? It accidentally started. It accidentally started and said that we lost a round, guys. Whoa. Where is this? Okay. What is this language? I have no idea what that is. I can't move. I can't move. What is going on? I can't move. What is happening? I cannot move anywhere. What is going on? I'm literally like underneath this guy. Who is that? I can't move. I can't move. Oh my gosh, dude. I can't move anywhere. I'm trying to move with keyboard shortcuts. I can't move. Well, this is lame. This is like two ones that are really bad. I want to say this is like, is this Israel? Is that Hebrew? That's where I'm going to guess. Dang, guys, this is weird. I don't know what happened. Why am I not able to move at all? This is very odd. What? I'm supposed to guess just with that? Maybe, is this Tel Aviv? It's a really big building for Tel Aviv. All right. I don't know, guys. It looks very, I don't know. I want to say it's Israel for some reason. I don't know. I have no idea. Jerusalem? That's a good question. No, I mean, they're two big buildings. Where's Tel Aviv? Where's Tel Aviv? Tel Aviv. There it is. I want to say it's like here. Ah, that's so frustrating. Maybe it's like one of these? No, it's in the middle of the buildings. It's like downtown. I don't get it. What happened? I can't move at all. $4.99, guys. 4,999. That was the best one ever. Holy moly. Wow, can you see it? Oh man, 1 second. I gotta change my thing. Wow. I just guessed. I was just like, is this Hebrew? I had no idea. There it is. There it is. Look at that. 4,999. 616 yards, dude. Damn. Yeah, move my prompt. That's it. Dang. No, I have never been to Israel. Oh, wow. That's crazy, guys. Where was it? It's here. Oh, okay. So it's like insane. And it's something. Wow. I don't know why I just immediately thought Israel. I don't know why. That's crazy. Oh my gosh, dude. Are you serious? This is like a non-moving one? Is that what the theme is today? We can't move? That's so hard. Dude, the museums are like literally the worst, dude. Is this, I want to say Louvre? Is this the Louvre? That's everyone says that though. You know what I mean? That's like the initial inclination is always to say the Louvre, but like, is it though? I've never been there. I have no idea. Folk art. Okay, so there's English. Is the Louvre, would the Louvre be in English or in French? Why can't I go down the stairs? Why can't I go down the stairs? Why can't I go? Okay. Let's go down the stairs. Oh my God, I'm so triggered right now. I'm so mad. Can I just leave? I just want to leave. Okay, so this looks like Van Gogh, right? This looks like Van Gogh right here. So maybe it is French. Maybe it is the Louvre. Okay, here we go. European decorative arts. This is all in English though. But here we go. European medieval Michigan Avenue lobby. Okay, so Michigan Avenue. It has to be on Michigan Avenue. What would be in Michigan? Where would it be in Michigan? Detroit? Michigan Avenue and in Detroit? Is there like a contemporary art building in Michigan Avenue in Detroit? Okay, where's Wayne Street? Where else would it be in Detroit? Downtown Detroit or Ann Arbor maybe? Isn't that like a little hoity-toity? Like a little better than like downtown Detroit? Michigan. I can't find it. This is not good. Oh, maybe this is Chicago. Wow, they have Michigan Street in Illinois. When in doubt, Pakistan. Definitely not Pakistan. Yeah, dude, they have a Michigan Street in Chicago, Illinois. There you go. Hazel's got it. Dang, guys. I've never gotten one of those non-move ones, and I've never gotten it to that close. 4,999. That was unbelievable. Thanks, Scott. Yeah, bro. Dude, it really is fun. I love GeoGuessr with chat. I think it's fun. I love learning about the world, man. It is so cool. I need to travel more. Okay. Next up. All right, now okay. So okay, guys. Here we go. A little science. Can you guys the gift goal is get through these roses and we'll go through something else. Shabam. Guys, big news. Bird's mysterious compass, the organ, has just been found. Guys, isn't it cool? I love science. Screen is too big. Okay. You can't, it's getting cut off on the left-hand side? Is that what you're trying to say? Thank you guys for all the gifts. Thank you, Who, Maria. Thank you guys. Bill, thank you. Okay, yeah. Well, I'm going to read it to you. I'm sorry. Yeah. Pigeons can sense the Earth's magnetic field by detecting tiny electrical currents in their inner ears, researchers suggest. That's crazy. In their inner ears. Such an inner ear compass could help to explain how certain animals can achieve astonishing feats of long distance navigation. I can think of turtles right now. I can think of pigeons. It's pretty amazing, right? Yeah, exactly, Hazel. How can they do so well? The team performed advanced brain mapping as well as single cell RNA sequencing of pigeon inner ear cells. Both lines of evidence point to the inner ear as the bird's magnetoreception organ. The results appeared in Science. Oh, dude, let's watch that. This is probably the clearest demonstration of the neural pathways responsible for magnetic processing in any animal, says Eric Warrant, a sensory biology researcher at the University of London in Sweden. Studies have suggested that various animals such as turtles, hey, trout, oh yeah, that makes sense, robins can sense the direction of strength of magnetic fields, although the evidence has sometimes been contested and the mechanism has remained controversial. But what is this, guys? Let's check this out. See if they have like any... Whoa, here we go. We're doing science now, boys. Yeah, exactly, Skog. I don't know. Like this sense of direction makes sense, I guess, that it's there. I guess it's weird, like that the cilia is like literally being moved. Is that what's happening? That's just crazy. But like there are magnetic. There's magnetic bacteria that do crazy things. So they create nanoparticles. Hey, Finding Solace AI, how's it going? Or Al, how's it going? Yeah, dude. So they'll basically have little pieces of iron or something that's in their cells, and then they can basically they can warp into the Earth's polar surface, so they can kind of like snap to it. And they use it. They use the magnetism of the Earth in order to orient specific ways. So it's not necessarily like people don't. It wouldn't necessarily be the cilia, but the cilia makes sense. But how? But my question would be, what's in the cilia in order to sense the magnetism? Yeah, Scott. I was looking to do nanoparticle based microbiology with those microbes. That's how I know about it. They basically create the nanoparticles as a form of UV protection. So it is wild. Wow, guys, this is so cool. So they did like some brain pigeon sensory organs. Wow, dude, these studies are so incredible. I can't imagine having a science paper, dude. They're so cool, dude. Like for real. I'm gonna geek out. That's like the best. Science is so cool. Science Mag. Science, guys, if you didn't know, Science Mag, this, the science is the journal from the United States. Nature is the UK. So UK, the Royal Chemistry, the Royal Societies of intellectualism, it runs deeper. Obviously, there's more time, right? In the UK, if you ever get inducted into like the Royal Academy of Science or something, that is incredible. That is an incredible feat. That is, up there with the Nobel laureate. There is a National Academy of Science in the United States. That's very prestigious. That's incredibly prestigious as well. But Science Mag is the United States R journal kind of thing. So I really love I really love it. I love Science Mag. I don't know. I'm really weird about that. Yeah, exactly. Yeah, exactly, Scott. Swedish Royal Societies, all the European countries. Europe has a deep intellectual history, right? Do you have a religious affiliation? Just curious. No, I don't know. Not really. I grew up Christian. I'm an atheist now. I call myself like a Christian atheist just because that's kind of like where my morals stand about like looking out after one another, love thy neighbor, use compassion, that kind of thing. It's evil to be rich. That's kind of thing. But I don't, no, I'm not religious. I'm an atheist. Okay. It's interesting. Yeah. The functional MRI, why not convert? Because I don't believe in supernatural things, brother. That's why. Oh, dude, no way. Model of magnetosensory circuit driven by electromagnetic induction. Yo, dude. That's wild. That is so cool. They actually have a whole mechanism. Changing magnetic field driven by head movement induces an electric field. Okay. So do they have magnetic parts inside of their brains? In the semicircular canals, which results in a voltage gradient within the endomel. No, so they don't. It's just the head movement. So just the friction inside of the space will create a charge that will be moved and sensed. That's wild, dude. That is so cool. Man, I love it. Yeah, Skog, yeah. If you want to read about it, I can put it in my, I'll put it in my stream notes. I'll put it in stream chat on Discord. Yeah, guys, that's so cool, man. I'm sure these guys are all super anti-vaxxers too, man. I'm sure they're super, you know, right, guys? I'm pretty sure they're all like, you know, I doubt they, you know, they're really hard skeptics. You know, I'm sure they're, you know. Okay, all right. Last one. Exactly. Birds aren't real, Skog. Exactly. Finally, someone's saying it. Someone's saying it, guys. Okay. So last thing, I wanted to start bringing to you guys. If you don't know, Climate Town is amazing. It is a great channel, and I want to like start using them and talking about them. I think that they're a really good climate perspectives, and I want to get out of constantly talking about vaccines constantly and want to talk about issues that I care about, right? I care about vaccines and stuff, obviously, but I'm just saying that like I dedicated my life to science, to solving the environmental crisis. That was my impetus to get into science. You know what I mean? To help save the environment that I love as a biologist and the negative impacts that humans are having on it. That's why I got into it. What's up, Bilbo Cameron on YouTube chat? How you going? You mean the science thing that they've devoted years of their lives to? Actually, for real? I know, Laura. It's amazing. Imagine that. Imagine that. But yeah, I mean, that's why I did, algae biofuels work. That's why I work with plants in order to make them more productive, in order to make, productivity higher, plant productivity higher. That's why I, tried to better algae biofuels with my PhD by giving nanotechnology to the the chloroplast biotechnology field. I love the planet and I want to try to help save it. No, it's not doing all right, Ruben. It's even worse than you could ever. It's not just the climate. So that's why I talk about it and I use my words specifically. It's not climate change. Climate change is just one way that humans are negatively impacting the environment, and it's a lot of different ways. So it's like pollution. It's the killing of and the mass extinction event that's happening of animals, but also of biomes as well. Entire biomes are going extinct. So like the wetlands habitat are just going extinct because humans want to live where the wetlands are. So they're getting pushed out. And so I wanted to I want to talk about something unique and awesome and cool, and apply our biology knowledge, something outside, more of my wheelhouse, and have more fun with it. Yeah. All right, guys. Here we go.
Witnessing one of the greatest 180s in modern history. The world's biggest oil companies are pooling their resources and going all in on solving climate change.
The world needs ways to reduce carbon emissions.
We're working on solutions in our own operations.
So who are we?
Believe it or not, ExxonMobil.
In the UK, 1.4 million households use 100% renewable electricity from Shell.
We all want more energy, but with less carbon footprint. That's why at BP, we're working to make energy that's cleaner and better.
Sure, in the past, they've dumped a bunch of oil in the world's oceans, and yeah, they've kind of covered up their own research about climate change, but now they are jackknifing away from climate denial and coming up with a ton of genuinely good solutions that should pull us out of this nosedive.
And like one of those guys is algae biofuels. Like Exxon did put about like $500 million into J. Craig Venter's biofuels company, Synthetic Genomics, in San Diego, and now it's Veridos. But you know, they are putting money. Legitimately, he's making a joke, but they are putting money into it. You know, so I'm curious where this goes. I watched the first minute here, and I stopped it because I was like, oh man, I want to react to this. So, what's up, Manny? How's it going?
Right now, we're driving 46,000 steel beams into the ground for a new solar project.
Carbon capture and clean energy from hydrogen.
Shell is producing ethanol, a biofuel made from renewable sugarcane.
Your banana peel could one day help fly a plane.
My prize peel? Keep away! It's my favorite junk food!
Awesome! The only problem with these advertisements is that none of that stuff is actually happening. Oh, sure, they are technically spending a tiny fraction of their money trying to install solar panels or trying to capture a little bit of carbon dioxide, but they're not doing it because they're making a bunch of breakthrough technology. They're mostly just doing it for the clout. And I'm hearing now that should be for the vibes. And I'm hearing now that should be for the aura farming.
Aura farming? Is that what? That's that it? Is that? Are we aura farming? Or is that what I'm doing? Help me, guys. Help me. Damn. I got to keep up with this. I'm happy to. Thank you. Well, why didn't you guys tell me earlier? I've been saying vibes this entire time, and you guys are. It's all supposed to be about auras. Oh, whoa. Wait. 1 second. I do got an aura. What's up? What's up, dude? Is this good? Is this aura farming? Is this aura farming now? I'm trying, guys. I'm trying to be hip. You know what I mean? I'm trying aura beta.
Come on, that can't be the right word.
Dude, that guy's chill.
See, oil companies have figured out that if they just spend a few $100 million on advertisements that make it look like they're working on climate solutions, they can buy themselves enough goodwill to keep quietly and profitably drilling for oil. As long as they're careful, they can imply these exciting new technologies are right around the corner, when in reality, they're not even close. But what that technology lacks in working, it makes up for in effectively delaying any kind of social or governmental opposition. And there's no better example of this than ExxonMobil's ad-fueled exploration of algae oil.
No, they're going to talk about it.
Raleigh Williams, a guy with a climate science and policy degree, and a therapist named Caleb.
You know what's funny is that my scientist group chat, which is we really met in an algae biofuels labs, and one of them was linked to this, and they were joking about it, how they creamed us. And I was like, oh man, I was like, I gotta watch this. So he's gonna throw a stake right into my heart, guys. I don't know. We'll see.
Which should be illegal. And this is a video about ExxonMobil's green slime. Welcome to Climate.
How dare he? Yeah, I don't know if high-speed rail is the ticket anymore, man. I think that time was past. I think we have to like develop the next generation. You know, we can't like the next step forward can't be the technology of 70 years ago that we should be failed on. But I feel like we have to kind of like go, what's the next thing? You know, I don't know. I don't know, man. I think that yeah, it's tough. Yeah, of course, dude. Yeah.
Now, most of us are too young to remember how gasoline advertisements used to look, but it was mainly just companies bragging about their new and exciting gas formula.
Conoco Super delivers the muscle many of these cars need. The new
It's all leaded fuel, guys. That's leaded fuel. They put lead inside of gasoline because it made the explosion better. So it was like something about like cleaning it better. So then, yeah, it's crazy, dude. It's crazy.
Performance unexcelled at regular price. The
mileage
test between lead-free Amoco.
So that's why it's unleaded, lead-free means that there's no lead in it, guys, because we were actually pumping lead into the atmosphere and people were breathing it in. We were aerosolizing lead and then breathing it in, and I don't know, guys. It's pretty crazy. Like there was a environmental toxicology paper that I read, and it was like 50% of the United States was exposed to some type of unhealthy lead levels in their childhood years if you were born and lived in the 60s and 70s. So we're talking like a serious explanation here. Dude, great. No, exactly. Explains MAGA and Trump. Dude, I'm not joking. Lead poisoning symptoms. Watch this, guys. I'm telling you, it sounds crazy, but look at the lead symptoms, okay? Symptoms of lead poisoning, okay? Hyperactivity, relentless fidgeting, learning problems, changing in behavior, headaches, vomiting, fatigue, anemia. In adults, lead poisoning symptoms may include personality changes, numbness in your feet, loss of sex drive, infertility. You know, I mean, I think a lot of what we were seeing. I'm not saying, but there. I mean, it actually blows my mind that we don't talk about this more. That this could actually have been, contributing to something not of our generation, but of our parents' generation, or the boomers that were growing up as kids in the 60s and 70s, and that could be hurting us long term.
Here are 5 other leading gasolines. 10 cab drivers, 10 housewives. Lead-free Amoco wins over every other brand tested.
But as the public started to get nervous that all of this consumerism might be having a negative impact on the environment, and maybe even wondering if these giant mega corporations were a part of the problem, a lot of oil company ads stopped being about gasoline and instead became about what incredible stewards of the environment they were. Get out there where you're free.
Dude, everything's commercials about freedom and liberty, dude.
BP, the way to go. On a moonlit California desert, a kit fox senses a prowling coyote. Caught in the dangerous open, she speeds to the edge of an oil field. Toward one of those curious mounds specially made for the people who work there. She shoots through a pipe.
Oh, it's the safety of an oil field.
And safe.
If it wasn't for the oil field, she would be dead.
Just to help an endangered species make it through the night. People do.
Exactly, Bill. If it wasn't for the oil fields, all the foxes would be dead. This is so much louder than my mic. Okay, interesting. Here. Is this better?
Real ad that Chevron really ran about What the fuck is happening here? They're building special pipes for foxes that coyotes can't get in? Wouldn't a tiny coyote slip right in, or a large fox be totally fucked and whatever? It doesn't matter. Just one of 1,000 sweaty examples of oil companies swearing up and down that their main job is to save the planet. And they have a tiny oil drilling hobby on the side.
Yeah, exactly.
When you do have to talk about oil, it's usually something like this.
So you think Conoco is just your neighborhood service station?
No.
Surprise, we're at work all over the world.
Amazing.
Conoco Petro
What? Hello, sir. I'm jolly old England. How's it going? Oh my raises, dude. Is he doing blackface? Did he put some? Dude, that's so racist. That is so racist, dude.
Yeah. I mean, I guess they were trying to say, we're global. But
We're global. Oh, what is that?
one company that resisted the new environmentalist turn. I'm talking about Exxon, baby. And if you want to get a sense for where they stood, here's Bloomberg's
Do not let them play
Chairman and
geoguessr.
CEO Lee Raymond gave in 1997. First, the world isn't warming. Second,
No.
even if it were, oil and gas wouldn't be the cause.
No.
Third, no one can predict the likely future temperature rise.
Oh, nice.
And if you want to get a sense for what other people thought at that time, here's a former Exxon consultant reacting to Lee Raymond's official position that scientific evidence remains inconclusive as to whether human activities affect global climate.
Oh.
I think it's outrageous that he would say such a thing because he has a world-class climate and carbon cycle research group in his own laboratory.
I was going to say the same thing, Heather, but I couldn't say anything. Oh, man.
On research and engineering, he could pick up the phone and ask one of the people in that group if that statement is true, and they would tell him that it isn't. This person should never be the same.
Oh, hey, guys, thank you so much. 100,000 likes. Thank you guys so much. I appreciate you. Guys, if we just spread off this rose thing, we can get rid of it. Thank you so much.
Of an energy company.
So it's not exactly a shock. that
Exactly,
Exxon
Gio.
kept doing the Fox pipe stuff and kept blasting out gas ads.
Thank you, Teresa. Thank you, Emilia. Living in America. Thank you. Thank you, Bianca. Helen, Allison, Professor Who. Thank you, guys.
$100 million to leave ExxonMobil, and the company tried to
Jeez.
join BP and Shell and Chevron as companies that were still extracting and selling a shit ton of oil, but were also willing to admit that climate change was real.
What?
Exxon got the chance to really swing for the reputational fences when bare-ass hippie liberal President George W. Bush from the Republican Party. I know I've done that before, but I think it's funny, so I did it again. Sorry about it. Anyway, George W. Bush.
See, guys, you can be funny and talking about science. You know what I mean? We're not all stiffs. You know what I mean? Come on.
Here we have a serious problem. America is addicted to oil, which is often imported from unstable parts of the world.
What?
Wow, things really have changed, huh?
What the? What in the? God, dude. Oh. I miss George W. Bush. I'll say it. I'll say it. For my Republican president, you know what I mean? I miss George W. Bush when that was as bad as it was. You know what I mean? Dang, dude. Yeah, exactly, Megan. Remember how bad we thought we had it? Remember how bad we thought we had it with George W. Bush? It was like... I remember those days. I remember we had it so good. Exactly, Bill. I'm with you, brother. Damn, dude.
Anyway, Bush's plan was to become less reliant on foreign oil by reducing our demand. Boo! And also getting America's fossil fuel companies to figure out how to generate oil from natural sources. Yay! Maybe. Can we do that? Well, yeah, we kind of can. We already make ethanol from corn and biodiesel from soy and other oils. Why couldn't these massive multi-billion-dollar oil companies figure out some new source that could produce a ton of fuel naturally? But what would that new source be?
It's algae. We did it. Dude, could you guys share the stream real quick since we're doing something fun and different? I would appreciate it so much. Thank you guys. Thank you guys so much.
That's right, algae, baby. Oil companies are going long on algae because it has a sort of cursed by a witch ability to grow, and we don't really eat algae,
Yeah.
so we're not using food to make food.
Thank you guys. Thank you for
Under
the
the right
shares. Thank you.
conditions, algae can replicate so fast it can cover the entire
It's
surface of a
guys, like for real though. I mean, the fact is that algae is just a floating ball of lipids and fats that you need in the oil, right? The plant matter. You was talking about switchgrass before. You know, switchgrass they have to build the plant structure, the plant cells. You know what I mean? The different parts of the plant that doesn't have the little fat sacs that you need. And that's kind of the nice thing about algae is that algae just grows what exactly that you need, and you don't have those stalks of corn husks and all that kind of stuff that you don't need. But algae just is that. The analysis is like algae is about 400 times more efficient than switchgrass, which is the best land plant analogy, you know. So it's like a way different. You know, it's way more efficient.
pond in the span of just a few days. In fact, algae can regularly experience growth so explosive that it suffocates an uncountable number of fish by oxygen depletion or dumping dangerous neurotoxins into the water. So, probably something to think about, but oil companies
Easy.
were mostly focused on the fact that some algae makes its own natural oil. So with some
Yes.
genetic modifying, maybe some
Hey,
environmental
that's what I do.
they could grow giant vats
That's
of
us.
natural oil-rich algae.
Yeah, dude.
They could then
That's what we
refine
did.
good old tank top and spank juice. ExxonMobil possibly
It's
sensing
true.
an opportunity to really plant their new flag, pledged
Yes, exactly. You can grow algae with or without sunlight. Exactly, Gio. It's called heterotrophic. So you can grow it in those raceways, but then you can also grow it just like yeast inside of fermenters, and it's actually super cheap to do it that way. So it is interesting, yeah.
$600 million to algae oil research and development.
Hey, that's what I was talking about.
$600 million in 2009.
Yeah,
When you
heterotrophic.
adjust for inflation is approximately $11 trillion today. Okay, it's not trillions, but it was quite a lot, especially when you consider the fact that it was one of these classic side projects that had basically nothing to do with their extremely profitable.
All right, we did it. We're doing it.
And you don't have to take my word for it.
What do you guys want? Lightning bolts? Let's do lightning bolts for the algae. People say that they like the roses because it's at the top, though. What do you guys think? I'm putting it up right now. Lightning bolts. Boom. Lightning bolts. Lightning bolts. Boom. Lightning bolts just dropped, guys. Amazing. Thanks, Manny. Thank you, brother.
President in charge of research and development at Exxon was not optimistic about the project. He questioned their ability to scale and noted a timeline of at least 5 to 10 years, and that's if they can get it to work at all. So naturally,
Yeah.
you expect these guys to be pretty conservative with how they talk about algae, right?
ExxonMobil and synthetic genomics.
Synthetic
have built a
genomics.
new
So
facility
someone-
to identify the most productive strains of algae. Algae are amazing little critters. They secrete oil, which we could turn into biofuels.
Volvox.
They also absorb CO2. We're hoping to supplement the fuels that we use in our vehicles, and to do this at a large enough scale to someday help meet the world's energy demands.
It's true.
That's right. With
You can.
exactly zero
It's true.
actual fuel made, Exxon is already running algae biofuels. And they're pretty careful to
Thank you, Bare Necessity. Thank you, Renee. Thank you, Ducre.
biofuels, and someday
Thank you,
meet
guys.
the world's energy demands. But this is basically the equivalent of buying a single lottery ticket and then bragging about what an incredible philanthropist you are because you're going to be donating millions of dollars as soon as your lottery.
It's not that bad.
And if you
How
look
dare
real
him.
close at that algae lab in the commercial,
That's not gender.
that's a real lab. I
That's
think that
completely
might be
fake.
some computer stuff. The results of algae oil disappointed scientists year after year. A lot of the other big oil companies shut down their algae research. BP, Chevron, and Shell
Yeah.
dropped their programs after it became clear that algae oil was not a commercially viable proposition for them. But not Exxon. They must have been having incredible scientific breakthroughs, and success was right on the horizon. Oh, dang. No, in 2013, Exxon's algae oil plan was going so badly that they had to literally go back to the drawing board
Yeah.
for the research. But it's always darkest before the dawn. See, Exxon...
I mean, that's like 2011, guys. That's right before CRISPR, right? That's like the problem is with algae biofuels is that basically the main workhorse of algae is called Chlamydomonas renhardi, and it is an amazing organism. It is where a lot of the eukaryotic research was done. So, do you guys know that electrical motor of like the electron transport chain? You know what I mean? The actual rotor that like goes around and people like talk about it, and it's in like every biology book, and like how you understand like how there's like, you know, things that was in the flagella of the Chlamydomonas cell. So it wasn't yeast. It was actually Chlamydomonas that did that. No, I don't. But we could watch Veritasium too. I'd be down. I'm honestly down to add some like science react stuff to the stream just to diversify it and it to kind of like be more fun. So is that too much? Did we do too much? It's okay. We're good. So yeah.
Exxon was the fox of hope, being chased by the coyote of reality. And fate was about to build them a grade A fox pipe. Because in 2017, they dropped a new ad. A different ad. An ad with actual numbers in it. Folks, I think they did it.
But yeah, I mean, but wait, before the strains, before 2011, I mean, you were just looking at you're basically trying to find a better strain of green algae. So you're like, okay, so if it's not Chlamydomonas and we can't make Chlamydomonas have a ton of lipids, like, could we use another different strain of algae or different species of algae? And they're trying to use sequencing that just came out, next generation sequencing. So they're trying to see kind of like, hey, what is in these things? What can we find? Is there another species that has? And there are some that are better. But the problem is that in order to change the sequences of the genome and the chloroplast, it's very hard, guys. It's very hard. There's only about like 15 species of plants that you can actually change the genome of the chloroplast with. So yeah, it's very, very tough. And that's the problem, you know. So you kind of go back to Chlamydomonas because that's what you can change, you know, molecular biology and genetics wise. You kind of go back to your workhorses because that's what you know, and but you know that's just what happens. But now, you know, with CRISPR and things like that, maybe that would change. So that would be the idea.
We just accomplished a very important milestone. We'll learn how to improve the fat content of algae.
Yeah.
We have gone from 20%.
Well, there you go. So that makes sense. 2017, guys. That means that I think this is probably Nanochloropsis. So Nanochloropsis is the second big kind of strain outside of Chlamydomonas that people use. And Nanochloropsis had a CRISPR experiment that changed the fat content dramatically. So I'm curious if this is the one that he's talking about. We are talking about ways that we can create a more renewable and sustainable oil for cars. So could there be a way to use algae in order to create the fats that we need in order to run our cars rather than using 300 to 400 million year old plants that are in the ground, and that's the oil that we stuck up. So, you know, we could use and create new oil as opposed to using old fossil fuel oil.
40% fat in the adjuvant.
Exxon announced they made the first step in their algae biofuel. You know, it's one step.
It is. I think it is that
Okay,
Nanochloropsis paper.
You know what? They figured out
Thank you,
how to
Manny.
double the naturally occurring fat in the algae. That's enough to launch a complete onslaught of algae biofuel advertisements.
Dude, it's cool. Don't you guys want to work on this?
By 2025, ExxonMobil is aiming to have the technical ability to produce over 10,000 barrels of algae-based biofuel per day.
My God, Oprah looks terrified. Imagine being so famous that you can wrestle Oprah on her own show and get
Here he
away
goes.
with it. Amazing.
Yeah, this is the paper. It's pretty well known in the algae world. This is it. Lipid production of Nanochloropsis gattiana is doubled by decreasing expression of a single transcriptional regulator. So they use CRISPR-Cas9 reverse genetics pipelined and inserted insertional mutagenesis of 8 to 20 transcription factors, knocking out the homolog for zinc cis6 encoding genes. The knockouts support Gruely, but the attenuation yields strains producing twice as much lipids, 5 grams per meter density as the wild type, 2.5. So yeah, it went to a lot. Well, it doubled. So anyway, that's the research.
Good job, Tom Cruise. Never change. But you may be wondering, was algae oil now in any way a viable fuel source? No, not even
It could be.
fucking close to close. At
It
the
could.
time, they would have needed $5 billion, almost 10 times their promised investment, just to build the facility that could produce the algae oil quantity they were promising. And remember, that's $5 billion for 10,000 barrels of algae oil, which is equivalent to 0.2% of Exxon's current.
Yeah, I mean the first time, guys, it's always the more expensive for the first time.
ExxonMobil is aiming to have the technical ability to produce over 10,000 barrels of algae-based biofuel per day.
Now, Your Honor, my client never said he wouldn't cheat on his wife. Okay, what my client said on the record was that he aimed to have the technical ability to not cheat on his wife. And we live in America, okay? This is not a kangaroo court. This is the US of A. And if a man can't cheat on his wife after not explicitly saying he wouldn't cheat on his wife in this country, where is he gonna cheat on his wife? Mexico? Anyway, over the next few years, Exxon spent $68 million.
I mean, it's like it's the first movers effect, right, guys? Where it's harder to be the trailblazer on something, and then you need to get it to the place of economy of scale, right? You need to like get it, and the first time is expensive, and then once you get it to a certain economy, a big amount, then the economics start to work in your favor. But and you're kind of brushed up against the fact that your main competition, which is the oil companies, are just pulling out oil from the ground. They don't have to make it like you do. So the competition's very, very tough.
Pushing ads about their amazing algae, which ended up getting something like 3.7 billion impressions.
Oh, it's Volvox. That's not even the algae that you do. That's so funny. This is this right here. That right here, that's called Volvox. It's a really cool little piece of algae. But it's not what they actually use. It's not what we actually use. I mean, but it's very beautiful. It's very, very beautiful, but we don't actually use Volvox. Nanochloropsis, if you guys want to see what it actually looks like, it's a single-celled algae that looks just like this. That is this. 1 second. I'll find it. Here. Just like right. It's just like a single-celled algae. It's like these things are going to be mostly chloroplasts. So when you look at it under the microscope, it's actually like you literally just see like half of this stuff is just a chloroplast. It's yeah. Yeah. And that's what you can see in this, like here too, like back here. This is Chlamydomonas roundhardi. So a lot of it is just chloroplasts because they're just a big solar panel, right? Each of these things is just a big solar panel for photosynthesis.
Propel ships.
You can do that.
Trucks.
And trucks and planes. Yeah. It's true.
Normal algae strains don't make enough fat for us to get fuel out of.
Having research partners outside of ExxonMobil is actually really enlightening. We bring to the table the perspective of scale up, and we have to go big.
I don't recognize any of those people. Algae is a small world, though.
I'm Dr. Kelsey McNeely, and someday you might be calling me an
That's what I used to do, guys. When I was an undergrad, this is what I would do. Like literally, I'd grow these bags. That was my thing. Where I'd make a small little beaker, and then I'd put all the media in these things, and then I'd grow them up. So that was literally my job, was to do this. I work for a couple of guys in La Jolla. Oh, thank you, Bill. I appreciate you. I worked for a couple of guys in La Jolla on algae tech, but they were sovereign citizens, so I ran. That's funny.
lives here.
They ran algae ads during the World Series, during
Yeah,
the
man.
NBA Finals. They paid the New York Times $5 million to run ads that looked like articles.
We did it.
Made an algae scientist Snapchat lens for the children.
Oh my god. Oh my gosh.
The thing is, the entire time they were running these ads, they seemed to have known that they were pushing a solution that was showing virtually no promise of saving us from catastrophic climate change in the near future. And
I mean-
how do we know they knew? We got their emails.
How could we possibly save it with one technology, though?
Oh yeah, Hillary Clinton. We're talking about emails again. And in internal communications, these scientists and experts involved seemed consistently uncomfortable with the language the ads were using. They worried that the ads give the impression that the work is in scale-up mode, when really, it's nowhere near.
Yeah.
So they landed on some sort of visually stimulating imagery.
Yeah, of
with
course.
Nice, vague language.
Algae have the potential to be much more productive than any other source of biofuels.
It's true.
Now we're taking this technology out of the lab and going to our new facility in Texas, where we're trying to make this something real, something scalable, something viable.
And it also becomes obvious why they're pouring so much money into these algae ads. The people love the algae. In Exxon's focus groups and all of their internal messages, they are blown away by how much people like the idea
Dude,
of
why not?
using
Then why not?
algae to make
Why not
oil.
do it?
The general U.S. population, big fan. The people cannot get enough of it.
It's cool.
In a particularly
Oh, this is like macroalgae, guys. So he has like leafy green algae here. This is not single-celled organisms, right? These are, brown algae. Those are like have structure. We're talking about, for algae biofuels, we're talking about single-celled organisms here.
Population, big fan. The people cannot get enough of it. In a particularly specific email to Exxon CEO Darren Woods, the Exxon PR team explicitly states the ad's objective is to showcase the company's contributions to environmental solutions.
Yeah,
which is
kelp.
in
Yeah,
direct
exactly.
opposition to their actual feelings about how likely algae oil is to be an environmental solution. And just before you
Yeah.
go thinking maybe
I mean, at those stages, right? But I mean, guys, this is all like the whole point of governments is to facilitate technology that would be impossible to do otherwise in order to make that a reality, right? That's the whole point of government, and that is why we publicly fund research, because private companies and private, for-profit models are incapable of putting money into something that isn't profit driven, right? In order to make it to that economy of scale. And that's why we do that. That's why the Inflation Reduction Act, by the way, put in $10 billion into algae biofuels. So we actually got that chance to actually maybe see that future, but your future got stolen from you and given to billionaires for their tax cuts instead. Like literally, that's what happened. So that is the world that we live in, unfortunately.
Heart is in the right place. In 2018, right in the middle of their massive algae oil ad blitz, Exxon put out a press release announcing they'd be increasing their oil production by 1 million barrels of oil per day.
Wow.
They're planning to add 100 times more oil than the total amount of algae oil they want to be theoretically able to make in 7 years.
Jesus Christ.
That's way more oil. And now, an ad. Location change. Okay, social media is an absolute news. What a deal.
Okay, I trust him.
And just one more thing. It turns out algae oil might not even be better for the planet.
Blanchard needs 2 to win.
This is going to be a life cycle analysis. So basically, the idea is that right now, you have to remove the water from the oils, right? If you have the oil, oil and water don't mix, right? Everyone knows this. But if you have to remove the water so you can separate out the lipids and the oil from the cell debris. Yeah, so you can do it centrifugation, okay? So let's say you centrifuge it, right? Now you still have that cake, that algae cake that still has water, cell debris, all that kind of stuff. So how do you get the water away? The water is the biggest thing. It's what the most of the culture is made out of, right? So that's the problem. And the amount of energy required in order to remove that water makes the entire process cost more carbons than you save, basically. So like in order to do it's called a life cycle analysis, right? You look at all the carbons that you use for energy in order to drive that evaporative process or that chemical. A lot of it is chemical right now, chemical process to remove the water. And then you see at the end, and it's like, oh, okay, yeah, it did take us more carbons to use that, so it's a net negative. But at the same time, man, like you're not pulling carbons from the atmosphere. You're not pulling carbons from the ground and putting it into the atmosphere. You're pulling carbons from the atmosphere, making the algae, and then with cars putting it back up into the atmosphere. So it's going from down and up. Oh, these are my new ones, but I've been wearing my old ones. So anyway, yeah, Geo, exactly. So it's carbon neutral, exactly. So but because of the evaporative process and the energy required in order to evaporate, it's not neutral. It does cost something, but it's still a lot less than taking carbons from the ground and putting it straight up into the atmosphere. That's just purely negative. So I would still argue that it's okay. I don't know. Let's see what he says.
By 1.
Yeah, Exxon was so
Exactly,
excited
Cloud.
to tell everyone that
It's,
algae oil was worth
guys, no technology is going to be the single bullet in order to help stave off the problem that humans are having, right? Humans are having a problem in that we are negatively impacting the environment in a whole host of ways. So the idea that there's going to be one single technology that improves all of the ways, that doesn't make any sense, you know?
because it emits half much greenhouse gas as regular fuel. If we could produce algae oil at scale, that would make a difference. But then in 2023, a group of researchers took a detailed look at the life cycle emissions of algae oil. Because while it might seem cleaner, there's a lot that goes into making liquid fuel from energy farming lazy rivers full of pond scum. And these researchers found that algae oil in its current state might actually be more carbon intensive than regular old diesel. According to one of the lead authors, Tom Bradley, microalgae-derived biofuel cannot outperform conventional diesel without a significant breakthrough.
Wait, the life cycle? Wait, when Bradley began this research more than a decade, he was extremely hopeful about the promise of microalgae, but he no longer sees it as choice. Cannot outperform conventional diesel. Like, the footprint of it? Wow.
Biofuel cannot outperform conventional diesel without a significant breakthrough.
Well, yeah. Well, yeah. Because there's no economy of scale yet. So, yeah, I mean, right now, currently, it wouldn't make any sense, but, like, the whole point would be to have it at scale that it does make sense eventually.
Exxon we're talking about. They're one of the most powerful.
Oh, nice, Hazel. That's awesome.
Western Hemisphere. They have an incredible plan to ensure that their algae is 100% emission-free. They shut down the entire program. So, technically. Yeah, after pledging $600 million on algae R&D in 2009, and then only actually spending $300 million on the science, and then spending $150 million telling everyone about it, in 2023, Exxon quietly shuttered their entire algae oil program. The algae company they were working with filed for bankruptcy in 2025.
Synthetic,
and the only traces of Exxon's algae projects are the ads that are still available online.
Nice.
And the vague sense from millions of Americans who saw those ads that Exxon was using like green slime to grease up windmills or something. I don't know, something eco-friendly.
That's so bad.
And the winner is
Dude.
And to top it all off, in the decades
Seriously.
that they worked on algae research, they never produced any commercially available algae oil. This woman must be devastated. Her entire profession, all of her fellow energy farmers, none of them ever actually farmed any energy at all.
Climate Town.
Hey,
Yeah, guys, check it out. Go subscribe if you don't already. It's a good channel. It's funny.
isn't that false advertising? Shouldn't they get sued for that? Well, the answer is they are getting sued for that. There was even a full congressional investigation called Denial, Disinformation, and Doublespeak, Big Oil's Evolving Efforts to Avoid Accountability on Climate Change. Which, like, that's the best title we could come up with? Come on. That's like 35 words. Just Big Oil's problems. Or problems with Big Oil.
Yeah, thanks, guys. Yeah, thank you.
Big bad oil. Any of those is better. Whatever. That's how we know a lot of this stuff and why we have all these emails. The investigation found dozens of examples of oil companies describing a wonderful tech utopia future while they were actually mostly drilling for more and more oil. And if you're wondering what kind of punishment these oil companies have received for their decades of obviously misleading ads, keep on wondering, baby. Yeah, despite a mountain of evidence, oil companies have largely been given a pass. But there is one lawsuit in the works from the Massachusetts Attorney General that'll be going to court soon.
Oh my gosh.
So we'll see what happens. But in the meantime, what are we gonna do about it? Well, it seems like oil companies aren't gonna change their approach because why would they? They're crushing it. Spend like 0.1% of your capital budget to do some light research.
Dude, I mean, they get subsidies, like insane amounts, man. I mean, it is wild. It's crushing how much money that they get in subsidies.
Slime and effectively convince the public they're the good guys? Yeah, that's an incredible strategy. I think it's a better question to ask ourselves what we actually want from oil companies. They're obviously not going to save us from oil. They make almost all of their money selling it to us. Exxon has made record profits in recent years, and rather than invest it in solutions, they've sent more and more of that record profit back home to their shareholders through dividends and everyone's favorite, share buyback.
It's awful.
They figured out how to get oil out of extremely dense rocks way underground. They've gotten really good at that, and they're gonna keep doing it. Where they've really gotten into our heads is convincing
Yeah,
us
exactly,
that because
Hazel.
they're good at getting oil out of the ground, they're automatically also good at solving the problems that fossil fuels created and innovating a bunch of new clean energy technology. Take Godzilla, for example.
What? What is going on?
Wow, that guy is incredible
Oh.
at destroying buildings. But does being a gigantic monster automatically also make him
Here we
good
go.
at cleaning up cities? Or maybe he'll promise to go to architecture school so he can eventually design new, less destructible buildings. Or maybe he'll just continue tearing ass through major metropolitan areas because why would he change? He's Godzilla!
I mean, they get like about $30 billion a year, I think, oil companies get. So it's a huge amount of money. I mean, the entire NSF budget itself is like 15, 20. So NIH is like 25, 30. So, I mean, we're talking like an insane amount of money that they get.
I guess the takeaway here is that these dudes are probably going to be reacting to climate solutions, not creating them. We keep waiting for these guys to rise up as our unlikely ally, but how many times are we going to be surprised when they end up stabbing us in the back? This is Gollum we're talking about. They're Scar. They're Fredo from Godfather. They're
It's almost done.
Littlefinger from Game of Thrones. Why are we trusting this guy? Look at his face. That's not a trustworthy face. He talks like this. Why are we trusting a guy who talks like this? He doesn't do the fingers thing. That's not about his... Whatever. It doesn't matter. This is every character from the movie The Departed. I think they're all up to no good in that movie. I can't remember. But this is what oil companies have been giving us for decades, okay? And it's time we started acting like it. So I guess just file this one under Fool Me Twice, Shame on Me, or as Republican President George W. Bush always says,
There's an old saying in Tennessee, I know it's in Texas, probably in Tennessee, that says, fool me once, shame on you. If fool me, we can't get fooled again.
We don't get fooled again. And that's the end of the episode. Thank you so much for watching. And special thanks to Amy Westervelt, Sarah Chow, and Dr. Robert Brule for their help and guidance on this episode. We paid to send the three of them down to Benihana together, and I hear they're having the time of their lives. Pro tip, if you wear a hat to Benihana's, the chef will throw a shrimp in. You've been warned. And also, if you liked watching this video, consider joining our Patreon page. Support from our patrons is truly the backbone of the channel, and it allows us to make videos like this without bowing down to shareholders or investors or really anyone at all. No one can tell us what to say,
Yeah,
and that's
guys.
good mostly. Plus, if you're a patron, you get access to behind-the-scenes clips, monthly town halls, and even the phone number to the Climate Town landline, a real phone you can actually call. I will answer it, and we'll have a nice little talk. Or we'll have a fight, whatever you want. I'm a yes-and kind of guy. Okay, I actually have a favor to ask of you, dear Climate Town viewer. A lot of people seem to have watched these videos over the years, and we'd kind of like to know if anyone is doing anything differently as a result of having watched them. So we made a survey to help us figure out if and how these episodes have affected how anyone out there interacts with the world.
That's interesting.
Maybe you've electrified your appliances, or gone to a community board meeting, even changed careers, that kind of thing. And this isn't a cry for help, we're not having an existential crisis, we're just genuinely curious, and this information could be helpful as we apply for funding or otherwise work to keep Climate Town independent. So if you have a minute to spare, please
That's cool.
consider checking out the link in the description to fill out the survey. We super appreciate it, and we'll even be raffling off some Climate Town merchandise as a thank you. But maybe you'd like
Cool.
to see these.
Well, guys, that was cool. I'm glad we looked into that. I think, like, again, I think, I mean, the main, he didn't really talk about, I guess, I don't know. I see it as a multi-pronged approach, you know, I really do. And it's like, I think that there are misgivings coming from it, but I don't think that it's just from, I don't think it's just from. I think there's legitimate, awesome things that are happening in algae. It's not just a oil company smear campaign propaganda tool. It's tough though. There is like no funding for now for algae, so it kind of is over and it is kind of dead because it's just not happening anymore. It's one of those programs that because of Trump and all the funds that have been stopped and they've all been it's all gone away. So I don't think that we're any better off because of that. I don't think that we are. I don't think that. I guess that what he was talking about, especially at the end there, I guess he's just talking about electrifying everything. There are problems with electricity. It's called a fungible fuel. So the idea is that the bonds that are created within the fat molecules of the oil that is used to burn, that becomes gasoline and that kind of thing. The bonds there are the same on the ground, in the air, different. And it basically that energy is held between the bonds itself. So it creates something that's very portable, and that's one of the reasons why. There's a lot of reasons why, but an electric 747 is just never going to be possible. So we have you basically have to have some type of internal combustion engine for airplanes. It's just not possible to do it any other way. It just, the physics of it doesn't make sense. Like the idea that you have a more weight for batteries, and then that batteries requires more motor power, and that motor power requires more batteries. It's just kind of like a constant, just the weight alone, it just doesn't make any sense. The density of, Renee, you're right. It is, that's fine. Right now, the technology is impossible right now. Gio, the biggest funder of biofuels was always the national defense. The idea that you could actually create all of our fuel here without having to worry about other countries, is a huge thing. So, if we want to get rid of, exactly, Gio, because of the aromatic structures of the and the density that's needed for jet fuel. Algae can do those complex aromatic rings. Exactly. It's frustrating. I think it's like, it just shows that there needs to be more money put into it, but it's one of those things. We'll have to see. We'll just have to see. All right, guys. Well, thank you guys so much. That was a really cool stream. I really appreciate that. I thought we got some good, some change going. If an idiot felon can take down the US, then why can't we fly batteries someday? It's just a technical feasibility thing. It's just like the energy density of batteries, and that comes down to so much of it, so much of batteries and electricity and all that kind of stuff. I'd love to be wrong. I'd love to be wrong. I'd love for everything to be electric and everything work out and it all be renewable and sustainable. I think that's the goal. It's not to like, I'm not an ideologue or dogmatic. I'm not dogmatic about my approach. Okay. I've worked in an algae biofuels lab. My PhD was trying to develop new technologies in order to better algae biotechnology. You know, but hey, if algae is never used again in the future of science, and all of a sudden we have figured out how to fix this problem and save the environment, I would be like, that's awesome. I don't care. You know, I'm not dogmatic about it. But I would see that it's a multifaceted approach, and I'd be shocked if there wasn't more than one technology that was used going forward. Like that's my point. So, okay, nice. Thank you, Mother Supreme Dragon Slayer. Thank you for doing that for us. Thank you for tackling that one. All right, guys. Yeah, that was a good stream, guys. I thought we did some cool debates and talking about those videos. I thought that was really good, and I don't think anyone else is going through that person's deep dive in those interviews. So I genuinely think that was an exclusive, and that was very fun. And I love talking about Climate Town. That was really cool discussions. So I think we start doing more of that going forward. So that's also why I kind of everything switched around. You know, switched the stream layout around, trying to be cool. And I love this cool Google Maps. This is a place on Earth, guys. This is just a place on Earth that exists. These are just cool places on Earth. You know, don't you guys like that? I like that. It looks cool. All right, guys, that's it. What a stream. Great stream today. I appreciate you guys. Thank you so much. That was really cool. That really helped with the hearts and stuff, and then transitioning to something else at the end there. That was cool. I've just been doing hearts the entire time. I wasn't even doing any live goals before, and then I heard you guys taught me that was a thing that I needed to be doing, and then I was only doing heart me's, and then now I changed it to something else after the heart me's, and that was like a huge thing. So I'm thank you for teaching me how to TikTok. I appreciate you guys. Oh yeah. Shout outs. Thank you guys so much. No need to read the wait, no need? Or do you want to? Why, what's wrong? Oh, dude, Bill, thank you so much. Thank you to the super fans. Thank you to Efon. Thank you to all the super fans. Thank you guys so much. Thank you to Bill. Thank you. Thank you, Renee. Appreciate you. Thank you, Manny, Helen, Heather, Marissa, Megan. Thank you guys so much. I appreciate you. Thank you. Nathi. Wow, I've never. Hi, welcome in. Maybe you changed your name. I'm not familiar. Thank you for being here. Bare Necessity, Helen, Tess. Thank you, Renee, User, Envy. Thank you guys so much. Yeah, Gio. Yeah, he is trying. Yeah, you know it. Thank you to the Patreons, guys. Just like Climate Town, thank you guys to all the Patreons. The Patreons really make a big difference. Guys, I know that the super chats are $10 a month on here, but the Patreons have $3, $5, $7 like stuff too. So it has different monthly amounts. So you don't have to do that if you're just throwing it out there. But the biggest thing, guys, action.drgregshow.com. I am thinking about, I'm going to retool our things. I'm going to start changing it. We're going to do it tomorrow. We have a lot to work to do. I'm going to change the actions. So we're going to change it up. I'm thinking about, I think it's better coverage if we're going to go state by state. We're going to go state by state, and we're going to go after state by state, and every single bill that they're trying to pass anti-science, we're going to hit all of them at once. And then the goal is going to having a template for every single state. So you can just say, hey, I live in Illinois. What are they doing in Illinois? Boom, I'm going to that template. Boom, I'm taking them on. That's the idea. That's what we're going to do. So you can facilitate that, and you can better help impact your state. But that's tomorrow. And we're going to do that tomorrow. I think that's a better way to organize it. Yeah, it's going to be good. All right, guys. Thank you for being here. Thank you. See you tomorrow. Thank you so much. See you guys. Go. Yeah, we did it. Yo, have a good night. See you. Peace. Bye. Bye. Thank you, YouTube. Thank you.